education advocates participating in today's webinar on private education planning for COVID vaccines, brought to you by the Philippine Association of Colleges and Universities in partnership with the Coordinating Council of Private Educational Associations and the Private Education Assistance Committee through their ASPIRE program, or the Assistance to Programs and Initiatives to Reform Education. We are live through our Facebook page, that's PACU, Philippine Association of Colleges and Universities, and we are also being streamed or viewed in various Facebook pages of PEAC, COCOPEA, SEAP, and also PPSP, the Philippine Business for Social Progress, and our PACU schools, Philippine Women's University and Cebu Institute of Technology University. So this is your host. I'm Joyce Samaniego from PACU, and this is part two of our two-part webinar series. As you know, last week, 2 weeks ago, February 24, we had our first webinar on COVID vaccine. So we had a deep dive on the COVID vaccines available out there. And we had around 26,000 participants. 90% have shown their willingness to get vaccinated just because of attending also that webinar. So that goes to show that we're also understanding more about the vaccines and its efficacy and effectiveness. So we hope that through this online session that we have this morning, we'll discuss the country's national deployment and vaccination plan and explain how it will be implemented in the national government, local government units, and partners in the private sector and development community. We hope to get more information as to how the vaccines will reach us. And as you know, starting last week, the vaccines have already arrived, and a number of our healthcare workers or priority under the prioritization have received the vaccine. So we'll get updates from that later on. So to officially open the program, we would like to call on the president of PACU and the president of the University of Perpetual Health System Dalta, Dr. Anthony Jose M. Tamayo.
I am profoundly honored to welcome all of you to the third PACU Education Management Series this 2021. I would also like to sincerely welcome all of our avid Facebook viewers watching from the cross-posted social media websites. Part 1 of this webinar had more than 26,000 views. Hence, we are hoping that another blockbuster webinar would happen today. The Programs Committee has worked hard and will present to you Part 2 of the webinar learning series on private education planning for COVID-19 vaccines. We have invited an esteemed lineup of experts to discuss the national deployment and vaccination plan and explain how it will be implemented by the national government, local government units, as well as partners in the private sector to reach the target population with a goal of minimizing, if not eliminating, related deaths and hospitalizations. This morning, our first speaker, Dr. Beverly Ho, Director of the Health Promotion and Disease Prevention Bureaus, will discuss the National Deployment and Vaccination Plan. Our second speaker, Mr. Guillermo Luz, Chief Resilience Officer and Advisor of the Philippine Disaster Resilience Foundation, will tackle PDRF support to the COVID-19 vaccination plan. Furthermore, we have Mr. Manuel Montinola, Vice President for Unilab Vaccine Initiative, who will discuss the Novavax Covovax vaccine, while we will have Dr. Nancy M. Bernal, Medical Director of Unilab Vaccines and Diagnostics, who will talk about the science of vaccines. Finally, Dr. Rizzi Alejandro, Secretary and External Head of AC Health, will share with us the private collaboration of COVID-19 vaccination, a perspective from the Ayala Group. May this webinar give you more information about COVID-19 vaccines, and hopefully you will be vaccinated if you have not yet decided so. Let us perform our social responsibility to get the vaccine as well as prevent the spread and mutation of the contagio. Let us do our part to achieve herd immunity and flatten the curve soonest. Thank you for joining us and welcome to this webinar, and we hope you will learn a lot. Please don't forget to practice social distancing, wash your hands frequently, wear a face mask and a face shield, and when you get the chance, get vaccinated. Always stay safe.
Thank you, President Anthony. To make our webinar more interactive, feel free to key in your questions for our speakers through our comment section found on our FB Live broadcast. And then before we start with our first speaker, we are conducting a quick entry poll. We request our participants to participate and answer this question. And this is regarding your willingness to be inoculated with the COVID-19 vaccine. When you're ready, you will see the question in the FB Live telecast. The question is, how likely are you to get a coronavirus or COVID-19 vaccine, if available, with safety and effectiveness comparable with other common vaccines and with FDA approval for public use? You can answer either likely or unlikely. I guess we have 685 in our audience right now. So we're just trying to wait for them to key in their answers. So we'll get an instant view of where they are right now in terms of their willingness to get vaccinated. Okay, so I think we have our results. 88% likely and 12% unlikely. So that's a very big baseline, huge baseline result for the positive. So most of you are willing to get vaccinated. That's a good survey result. So we'll see later on if this 88% will be 100. So for those of you who might be asking, the link to the evaluation forms will be found later in the comment section. Once accomplished, you will receive your certificate of attendance. So, okay, to start the ball rolling, I'd like to introduce our first resource speaker. She is the concurrent director for Health Promotion Bureau, and this is Disease Prevention and Control Bureau, and special assistant to the Secretary of Health for the Universal Health Care Coverage at the Department of Health. To discuss the National Deployment and Vaccination Plan, we are glad to have us together in this webinar. Let's all welcome Dr. Beverly Lorraine C. Ho.
Good morning, everyone. Good morning to the organizers, to all our organizers for inviting the Department of Health into this session. To Sir Anthony, thank you very much for allowing us to use your platform to get to more Filipinos and collectively increase vaccine confidence and readiness of our implementers on the ground. First of all, before I begin the presentation, I would just I know vaccine confidence really high in this group. And perhaps the question is really around, baka after vaccination ba, we can go back to not wearing face masks and face shields anymore, no? I guess from our end, we just really wanted to say, yes, it's something exciting for all of us, but it's always going to be another layer of protection. And you can look at this diagram to see that vaccines is an added layer of protection, or just simply think about paano po natin siya ginagawa before, di ba? Sa mga protection natin against kagat ng lamok, di ba? Layers of protection din tayo, no? Not one intervention is enough, no, to avoid mosquito bite. So vaccine will be similar to this. And then just allow me to swiftly just go through sino ba talaga no naapektuhan ng COVID cases at sino yung namamatay from COVID. And you'll see that the demographics are really very different. And this is also going to be later on the reason why certain people are going to be first and certain people are going to wait a little bit more than the others, no? So most of the cases are relatively younger population, but the deaths are really among people who are more than 60 years of age. Then we also need to know about the three outcomes that we are talking about, which is mild, moderate, and severe COVID infection. If it happened to be that mild COVID infection lang, lahat ng COVID, actually, chillax lang po tayong lahat, di ba? Hindi naman siya dapat nakakatakot. But it's really that having severe COVID infection is the one that worries us all because it's the one that is attributable to a lot of the deaths, no? So, ang pinaka talagang gusto po natin maprotektahan, yung mga sarili natin, especially our healthcare workers and the vulnerable citizens, so senior citizens, mga may comorbidities, is this severe COVID infection, no? And so, let's just briefly go through some of the key concepts that we can reinforce after po your first webinar series, no? So, in assuring you that the COVID-19 vaccines are going to be safe and effective, here we show you the different expert groups who are all made up of independent, no? Ibig po sabihin, they're not salaried by government, they're from universities, they're from the private sector, and they can really say what they want to say, no? And so our expert groups are independent, and they help us in assessing in terms of the research and development part, no? That's our vaccine expert panel of the DOST, the regulation part, the FDA expert panel, and the Health Technology Assessment Council. And then there's the vaccination part, the interim NITAG that we have. And then the monitoring part, which is the NAFIC, or National Adverse Events Following Immunization Committee. But you'll also, here in this slide, you'll also see what do they actually contribute to, no? So FDA, based on a law, no, they're required to actually regulate safety, quality, and efficacy of the vaccines. The HTAC, under the UHC Act, is required to recommend, no, based on their economic and societal evaluation of the actual intervention, in this case, the vaccines. And they need to have a positive recommendation on things that the government is procuring. So maraming nagtatanong, kapag donation ba, hindi kailangan ng FDA, ng HTAC approval, no? So based on the law, una, hindi po, no? Pero bakit din hindi, no? Kasi there are many things that have been donated in the past, especially during the time ng pandemic, Avigan, di ba, yung mga remdesivir, hindi po sila nag-undergo ng HTAC assessment. But we are sure that they're safe because FDA issued a permit for them, no? So magkaiba siya. Sa HTAC, it's really to inform whether bibilhin siya ng gobyerno or not. Then finally, the NITAG and TAG, isipin nyo po, mas operational yung advice nila. No? They don't look at the vaccine, they look at the people or the processes around the delivery of the vaccine. So in short, no, marami kasing nalilito, ano ba yung role ng mga expert? Pwede niyo isipin na ganito siya, no? So the brand of the vaccine, kunwari the X vaccine, diba? The AstraZeneca vaccine is what, no? So safe and of good quality for use of certain individuals. Si FDA po yung magsasabi niyan. The indication or it's effective for which type of population, ganito siya, paano siya gamitin, FDA pa rin magsasabi niyan. Pero kapag yung magsasabi po na, meron siyang benepisyo, no, in terms of health, in terms of economics, sa buong society, meron siyang effect, positive effect, HTAC po yung magsasabi nun. Kailangan ba siyang bilhin ng gobyerno? HTAC rin magsasabi nun. Then yung last is, the supply should be provided for or should be prioritized for certain population. Yun po yung NITAG, no? Or should be delivered through hospital, should be delivered through individual or private public clinics. NITAG po yung sasabi nun, no? So all of them are complementary. So we know that our vaccines, 80% of the global vaccine stocks are actually already consumed by the high-income countries. And so the vaccines will not all arrive in one go in the country, di ba? Hindi po 100 milyong bakuna dadating isang araw, no? It's not the case. That's not the case. So they will come in tranches, di ba? And so who are the people that we need to prioritize? So based on what I've shown you kanina, di ba? Who are most at risk? It's your frontline healthcare workers, your senior citizens, and people with comorbidities. And that's why they fall under priority eligible group A, A1, A2, A3, diba? Then the others will follow, no? Frontline personnel in essential sectors, indigent population, teachers, social workers, kami po, other government workers, after po ng teachers, no? And then the rest will follow. So, bago all remaining Filipino citizens. So, may nagtatanong din po, like, syempre, no, among healthcare workers, kunwari, or later on, among senior citizens. So, 1.8 million yung healthcare workers, pero 1 million doses pa lang ng bakuna yung dumadating sa Pilipinas. So, sino mauuna, no? So, within the priority group in the first column, we still have criterions, no? So, sino yon? It's going to be based on the area where you have bigger COVID-19 disease burden, and it's going to be based on exposure. So, for example, if you're someone who's working in Batanes versus someone who's working in Manila na mataas yung case, mauna po yung Manila, di ba? But at the same time, mauna rin yung certain healthcare workers who have higher exposure risk than less exposure risk. And I'll show you in the next slide, no? So, kunwari, among healthcare workers, hindi rin lahat sabay-sabay, no? Sino po yung mauuna? So, obviously, the COVID-19 referral hospitals because they get most of the COVID cases. Then next, the other hospitals catering to COVID-19 cases. Then quarantine isolation facilities. Then remaining hospitals. Then, etc., etc., no? So, you'll see in sequence din siya. But this graph below shows you that even among hospitals catering to COVID-19 cases, which are not dedicated referral hospitals, meron din pong sequence, no? So if you're a DOH hospital that's level 3, mauna kayo, then followed by other government hospitals na level 3, then private hospitals na level 3, then we go to level 2, then level 1. No? So may sequence tayo. And it's dependent on the master list that we have received from the hospitals. Now, people ask, do you have to pay for anything? So the policy directive of the president on this is that vaccines have to be free, no? And that would be because they are provided by the COVAX facility. They're going to be funded by loans from World Bank and ADB, and there are tripartite agreements that have been put forward. So the condition there, before was that the private facilities or the private institutions will be providing to their employees for free and donate 50% to the government. And LGUs who will buy also need to provide to their constituents for free. And then people also ask, when and where will you get vaccinated? So it really depends on your priority group and when the vaccines are arriving. But it's important to know that it's the LGU that we need to wait for their announcements. No, the recommendation is that we finish the frontline workers and senior citizens. After that, sabay na po, no? So the national government, LGU, and private can go together na po sa pag-implement. So all of the vaccination will happen in vaccination sites, meaning it's not going to be home service, no? And the reason for this is because you need 30 minutes to 1 hour observation within the facility because the adverse events usually happen during that time. So the idea here is that both the public and the private health facilities who will be working on the vaccination will have to do their pre-planning activities. And the pre-planning activities will be led by the local government units, no? So yung focus of implementation will be the local government units. Ngayon po, for healthcare workers, mas diretso sa hospital po, no? But eventually, as we start senior citizens, talagang LGU po yung mag-lead, no? So it's the LGU who will assess, decide, okay, I don't have enough facilities, I don't have enough vaccinators, I will need to tap the schools, for example, or I will need to tap certain private sector providers. So they will have to draft their overall plan, they have to do mapping of vaccinators and vaccination sites, and they will have to do training and simulations, all of which have existing modules already. So there will be also QSLs, no, or quick substitution lists that at least for the hospitals, they need to undertake. At ganun din po for the LGUs eventually. So this is because we don't want to waste any of the precious vaccines, diba? So ibig sabihin, alam natin, okay, today, 500 people signed up, but probably there's 10% who will not show up. So just in case they won't show up by 3 p.m., who will we call, diba? Is it the katabing hospital? Is it the health workers in the primary care facility na malapit sa hospital, etc. No? Because we don't want to waste vaccines. Also, the master list that will be submitted, at least now for the healthcare facilities, will have to be endorsed by the medical center chief. So he is attesting na itong mga nasa listahan na to, no, parang hindi yan ghost employee. No? They're really frontline healthcare workers. Then we also get a lot of questions around who can get vaccinated. So on the day of the vaccination and during or pre-vaccination day, it's important that we do several steps already. No? So the first 2 steps, as mentioned, they're being done by the LGUs or the hospital, which is to identify vaccine and eligible population and do simulation. But after that, the profiling, screening, and registration already has to happen, and the vaccine allocation and distribution will be done by the DOH. So kunwari po, ngayon for hospitals, the hospitals master listed their staff as early as January. No? So sinabit nila, and at that time, so the assumption is hindi siya dependent sa brand. No? So ngayon, we are offering 2 brands to the healthcare workers. But hopefully in the coming months, we will not have brand-specific issues anymore. But it's important to say that for some brands, no, some people can get those vaccines, but some can't. No? So kunwari, mataas yung allergic reaction na possibility dun sa ibang brands, then we have no choice no, but to offer another brand to that individual. So then on the day itself, we do vaccine administration and surveillance for at least 12 months after the vaccination. So medyo matagal-tagal. So I want to emphasize here that the vaccination process in itself if any of our audience wants to commit to be a vaccination site or be part of the entire process, this is not a 1-day or 5-day sign up. The reason why we're being very careful about engaging vaccinators is because you really need to be linked very well to the local health system, even after the vaccination process. Kasi if people do get reactions a few days after, a few months after, the people that they will call is the vaccination site. Because the vaccination site should be able to retrieve the records and nabakunahan ba namin talaga to o hindi. Diba? So hindi siya pwedeng parang, okay, tapos na, nabakunahan ka na, done. So it's a 1-year surveillance process. So I won't go through this in greater detail, but we'll be sharing the slides with all of you. There are vaccination teams that will be required in the area. So the main composition would be 6 people. And for your AFI team, there will be 2 people that will be needed. So parang 1 vaccination team will need 1 adverse event team. And 1 vaccination team at least should be able to do 100 vaccines per day. So syempre with efficiency measures, this can actually even be better. So tapos klaro naman, I told you kanina, our strategy is a fixed post vaccination strategy. Meaning we won't go through house to house. So meron ding certain mechanisms na pwedeng gawin in say geographically isolated and disadvantaged area. So fixed point vaccination strategy pa rin tayo, pero house to house yung social mobilization strategy natin. And in certain cases, kailangan mag-pick up ng tao, meaning some of the LGUs might need to arrange vehicles for ferrying their people into the vaccination sites. So skip ko na to. And then really just show you that there are templates for how the entire setup will have to be put in place. And then we also do have materials, templates provided for every area na kinakailangan. So for example, dito, while they're waiting for their final consent, videos for how to counsel, etc., are already available for use of the implementers. So medyo templated na po to lahat. So you'll see here an average 15 minutes lang yung per person from registration to vaccination. So also several infection prevention and control strategies will have to be implemented. Meron din po kaming mga fact sheets that we have already prepared, and they're all in the drive that I will be sharing with you later on. So it's all just printing them and then using them. So they're in Filipino, English, and I think Bisaya. Yes. So in answering the question on who can be vaccinated or not, we do have these templates. So the first one is the screening form done by the healthcare worker. But the second one really just summarizes who should not get vaccinated at all, who should defer, who should need clearance, and who should get special precaution. So meron na nakalagay dito. So very simply, if you say, oh, I have cancer in the past, am I eligible for the COVID-19 vaccine? So here, if it says need clearance, then you likely need to consult your specialist, and your specialist will tailor the advice based on your history, diba? But if you say, oh, meron akong diabetes or hypertension, so here naman, hindi siya nakalagay as any reason for deferral or needing clearance, and that should tell you that you are actually eligible for the vaccination. So overall, you need to be assessed again on site. Then they will ask you the screening questions, and then whether or not you get vaccinated or not. So yun. So this is just the same as what I've shown you, only that it's more graphical in nature. So sino yung needing clearance, sino yung may special precaution. So the post-vaccination monitoring period in general is around 15 minutes for general population, but those with history of allergies or asthma, they will be asked to stay on for at least 30 minutes. And then we do have the Philippine Society for Allergy, Asthma, and Immunology also developing clinical practice guidelines, which we have adopted. So ito po yung zoom out ng malaking health assessment algorithm. So nakalagay na dito lahat ng mga tanong at whether you should be referred, you should reschedule. So marami rin po nagtatanong sa amin, if you previously had COVID in the past 90 days, pwede ka ba magpabakuna? So kapag nagka-COVID ka within the last 90 days, you are advised to reschedule after 90 days. So 3 months after you've had COVID, tsaka ka recommended to have vaccination. So for pregnant women in general, if you're in the first trimester, reschedule, meaning second or third trimester, okay tayo magpabakuna. So yun. So what should you do after you get vaccinated? Oftentimes, people panic about certain reactions. But what we want to say is that these are usual reactions. So local symptoms, swelling, pain, and redness are normal reactions to vaccination. Thereafter, it develops into headache, fever, or fatigue, which are, again, normal. What's not normal is you can't breathe after you get a lot of uncomfortable hives in your body, you sweat a lot, etc. So those are triggers for the healthcare worker in the site to do other medical procedures sa'yo. So lastly, we're sharing the materials that all of you can download. We do have a specific set of materials also for healthcare providers or implementers on the ground. I think I'll just share it with the organizers later on. That would be all for now. Thank you.
A discussion on the national COVID vaccination plan. We will be starting with our Q&A with Doc Bev for the first part. So she won't be able to stay na for long. Ang daming ginagawa ni Doc Bev for us at DOH, and we understand that. So if you have questions, our audience from Facebook Live, you may ask it now for Doc Bev. So while waiting for your questions, I'll start the ball rolling, Doc Bev. And of course, this is first of all about the. It's good that you said about yung first slide mo about the wearing of masks pa rin despite being vaccinated na. So that clarifies. Kasi ang dami kung naririnig na news na hindi na daw kailangan. So anyway. First is on the prioritization po. Maybe we can go back to that slide or the eligible groups. So dun sa 5, so we've started with the frontline workers na. And then you mentioned senior citizens will be care of the LGU. And those comorbidities, as you mentioned, yung mga are they indigent or just comorbid? Hindi siya mix ng number. Where's the indigent? Nasa 5 na pala siya. Dati nasa number, I think nasa 3 siya. Opo. And the group that discusses this in DOH is the NITAG. Sila po yung nagtatag or yung prioritize. Arbitrary siya pero may dahilan po kung bakit siya nagbabago yung prioritization.
So they did a couple of assessments to make sure, di ba, kung sino talaga yung at greater risk. And so originally kasi inisip, okay, the indigents are going to be the people who are living in crowded spaces, so the rate of transmission there will be higher. But then when they look at several other studies, it's really the comorbidities that drive the deaths, diba? And the disability, no, the severe infection. So the people with comorbidities rose up, no? So kung indigent siya, tapos may comorbidity siya, so mauuna rin siya, diba? So yun yung qualification doon.
And the comorbidities include disadvantaged populations.
As
Women,
long as if they have comorbidities, yes.
if they have comorbidities, is pregnancy a comorbidity po?
No. It's a natural occurrence in a human body, so
Okay,
it's not
sorry.
supposed to be a disease.
No, but is it number 3 in the priority list?
No. You're not. You don't have. You're not
No.
considered a disability, no. Kapag.
So, okay. One of the questions po on this is students. Our children, are they, where are they in the priority list? Of course, we said, diba, 18 years old and below, hindi siya covered. But we still have college students are going to school, and then actually most of them, yung mga allied health students are doing face-to-face for OJT. And of course, they will be our future nurses, doctors, and etc. Will they be included in the top 5 priority list? Doc Bel?
Actually, if you're a regular student that doesn't have any interface with patients, then you're part of the rest of the population. But at least for the medical students, they have been included, and I think the nursing students who are still rotating, they've already been included in the list in the hospitals. So part sila nung letter A if they have rotations.
Correct. Look, Bev, yung about I'm just getting some questions on Facebook. Can people with high blood and increased blood sugar levels or diabetes? So actually, this was answered. They're part of those who have comorbidities na. Are the healthcare workers from the private schools be included in the priority for the vaccination? The answer is yes. Yes.
So they're part of letter A, but a lower part of the healthcare worker group, no? So, di ba, pinakita natin kanina within the healthcare worker group, it depends on what your risk of exposure is.
Okay. Doc, then how about the teachers? Our teachers, kasi they're also part of the number 4 in our priority group. Frontline, are they part of number 4? Frontline personnel in essential sector. Is education an essential sector? And are private school teachers, apart from public school teachers, also included in that bucket?
The teachers and school administrators are specifically included in Group B, no, the first in Group B. So B1 and then actually B2 yung other government workers.
So Doc Bev, yung nabanggit niyo about schools can be tapped as third-party providers. The DOH budget for the actual implementation of this. And then you mentioned nga na there will be, the vaccination site must be picked very well, and it's not just a very short 5-day program. It's actually 12 months because there might be cases wherein might be adverse reactions that they need to monitor. So from the start, when they begin with the vaccination till the end of the everyone is already vaccinated po. So what kind of support can we give to our schools who will be participating as vaccination sites po, Doc Bev?
So it's really the LGUs who will be deciding, no, if they will tap schools or if they actually have sufficient facilities already and vaccinators. So that's the first part. Second is that the national government counterpart in all of these initiatives is really the vaccine, diba? But oftentimes we know that the cost of the vaccination program is partly vaccines and partly the deployment, diba? Yung gagamiting bulak, kuryente, etc. on the actual vaccination day. And the LGUs are asked to, that's their counterpart. No? And like many other immunization campaigns or programs that we have, that's always been the counterpart of the LGUs as the devolved or primary mover on the ground. So that said, it's the LGU that will engage their private sector counterparts if they think they will actually be needing the support of external parties in implementing the vaccination program. So for example, if I'm an LGU and I have several other private entities that actually ordered vaccines, diba, through the tripartite agreement, then I will have to, that's parang weight off my shoulders already, diba? And really ask the private sector partners, okay, how will we work together? The LGU needs to make sure that they actually get seamless transmission of all the data, diba? Because the LGU's health office will need to know sino yung nabakunahan doon, meron ba nag-adverse event doon, etc. Diba? But they should be working hand in hand.
LGU, even for the local DOH, they should be providing parang a permit and at the same time yung support to that private school who will be mostly kasi mga schools na may hospitals na, di ba, based hospitals, might be very interested on this. Yung kung sa vaccination sa schools, kasi although maybe we will discuss later on yung sa private sector naman po, kasi marami tayong from the private sector, from the schools with us today. Pero they're concerned po kasi dun sa dun sa added cost. Syempre, bibili ng bakuna, pero what are the other hidden costs ba that they might be charged? So pagka nasa private sector, like kunwari a school for example decides na as a school they will buy from a private partner, ganun, sabi niyo po 50% will be donated to the government, tama po? And the 50% sa kanila, they will use it among themselves sa private. Can it be that the 50% na dapat sa government will just be given to the schools, especially those who cannot afford paying for the vaccine?
So by default, the government is supposed to provide the vaccines, no? But then the private sector agreed to pitch in. So this is actually completely voluntary, diba? The private sector raising money to buy their own vaccines. So by default, if the school doesn't have resources, they should actually get the vaccines from national or local government. So hindi naman po required that they raise their own money for the vaccines.
Okay. So with that said, kasi also we're looking at the possibility of face-to-face classes. With this po, how will it pan out if it's voluntary and yung schools don't have the capacity to pay for all of the employees and actually even the students and the parents? Parang what's your insight on?
Okay, I didn't say it's voluntary. No? The voluntary part is raising money to buy vaccines. That's the voluntary part for the private sector who have the cash, diba? Who have the money to do down payments, etc. Vaccination is voluntary in the sense that you need to be informed, but the national government, along with the local government units, because this is a public health issue, the vaccines are going to be made available. So that's for all Filipinos pa rin dapat, no? So minus the private sector who actually bought the vaccines. So whatever the private sector is donating will also go into all other population in the country who's in the list, diba? So lahat naman mababakunahan. So meron lang iba, mas may kaya sila, so nag-secure na sila ng resources para sa sarili nila.
Noted po, Doc. Maybe later I'll ask also our private sector partners for more details on the vaccines. And Doc, about the school opening, this is a hot topic right now. Of course, we're planning for school year 2021-2022. And do you think we will see some semblance of normalcy by the mid-year? I mean, no naman that we're starting, but do you think we will be having open or face-to-face classes by June? For sabi niyo nga po, sir, ma'am, yung priority natin is based on the need and kumbaga their risk, okay, of getting so students, no, do you see that there's gonna be open school opening by June for basic ed and or higher ed?
I think that's a policy question. But if I should answer it from a scientific perspective, we know that there is enough literature to tell us that the full development of children requires that they be able to attend face-to-face education. Diba? I think I can only answer for the science because this topic is very heated and at all levels of powers that the decisions are actually being made, no? Which is beyond our pay grade. So I will just answer it based on the scientific merits.
So the one who decides this will be under which level sa the entire hierarchy of things?
Primarily, it's actually DepEd that needs to propose, diba? Because this is their sector, no? So kami naman input from a health perspective, yun. Pero at the end of the day, the president gets to also syempre decide. So hindi siya DOH, that is not under our purview.
Kasi we're seeing DepEd nga, saying, proactively saying na we should start online. But we all also know that the parents most of our parents are also quite hesitant. And I guess yung culture of trust syempre on the vaccines must be high para rin talagang magbukas tayo ng classes. So just a few more questions po dun sa prioritization. Sa senior citizens po, marami pa rin hindi desidido na magpa-vaccine, considering, I don't know if it's also because of the brand. I hope it's not because of the brand, pero marami pa rin hesitant sa mga seniors. If they choose, how many seniors are we looking in the country to be vaccinated? Are they already included in our plan? And must they all be vaccinated daw, sabi ni Doc Bill, Sir Bill, before everyone else?
So I think the current estimate is around 9 million. So the discussion with the NITAG in the past was like we go sequential, diba? So A1, A2 after senior with comorbid, etc. Now the agreement lang is we finish until seniors, no? And then afterwards, we can do parallel implementation already. But it means that we need to finish senior citizens from Apari to Holo, lahat na healthcare workers and senior citizens matapos natin in the entire country. And then we can do parang kumbaga more patchy implementation na.
Would you have the numbers po? I don't know if you have the statistics now on our target population that have already been getting the vaccines.
You mean currently?
Currently, sir, ma'am, and then versus the plan, the target. Are we
Well,
meeting our targets po
Well,
in
the
the
target, the target that Sec Charlie has set out for the vaccine cluster is 70 million Filipinos by the end of this year, no? And that's assuming that all that we ordered abroad will actually arrive on time, diba? So that's the biggest assumption, no? So we're seeing that even the biggest companies are not able to actually deliver their vaccines, so kahit sa higher income countries that possibly paid them even more for those doses. So actually we're very much hoping. So for healthcare workers, we have a target of 1.8 million to vaccinate. Then for senior citizens, it's actually around 9 million po. So that's 10% of the population, has 11% overall.
And we're looking at 70 billion, no, Doc Bev,
Yes.
to be vaccinated. When, sorry po, Doc Bev, pero itatanong ko po, ilang percent nung 70 million, yung at least siguro sabihin na natin, we can, for, ito po, based on your opinion or if it has been spoken sa yung pwede na tayong to go with our normal lives. Like for example, yan, open tayo ng classes sa basic ed, higher ed. When do you think should we start deciding on that? Is it too early now to tell, or when is the kumbaga yung quota natin sa tingin natin relatively safe na to our normal way of doing things or online or open
Okay. So I think I would just like from a scientific standpoint, no, obviously the safest is your herd immunity percentage, diba? That's a lot. Pero balikan lang natin yung numbers, no? In the first few slides that I've shown you, why is COVID-19 nakakatakot, diba? Because it can lead to deaths, diba? Kung normal lang siya na flu every year, hindi naman tayo matatakot ng ganito, di ba? It wouldn't actually paralyze all of us if it were just ubo-sipon or at worst trangkaso na hika lang nakahiga ka the entire day. But it just leads to deaths. And that's severe infection. So who are the people that are at most risk for severe infection? We already know that. It's elderly and those with comorbids, diba? And most of those comorbids are actually elderly. So I do think that a lot will change after we finish with healthcare workers and elderly population. Kasi kaya ka lang din naman takot, diba, sa bata na nasa eskwela is because they're supposed to actually be carriers, diba? Pero nagki-carry sila to whom, diba? Kaya katakutan lang din naman natin ang mahawa nila yung really vulnerable elderly. So let's see, the data is coming out from all of the other countries that have started implementation. And you'll see the drastic drop in deaths in UK among elderly. And that actually triggers a lot of hope sa kanila, no? Kasi sila yung namatayan talaga ng maraming matatanda. So ako from just a scientific standpoint, that's where I see a possible inflection point.
Thank you, Doc Mel. Siguro a few more questions. I just look at the Facebook page. They have questions about yung lactating women cannot really get vaccinated against COVID-19. Yes or no?
Actually, so far, the recommendations of UNICEF and WHO is that there's no strong contraindication. There's no reason for them not to get it. So especially if they're actually healthcare workers, and there's some little evidence already that's showing that they can pass on the antibodies to the babies who they breastfeed. So parang promising siya.
So,
Ma'am Joy, sorry. There's a question of Doc Karen in the Viber group. Was it asked? I wasn't sure.
This is regarding the prioritization for deliveries. Are suppliers allowed to deliver ahead to private sector, or all government orders have to be ordered first?
Um, I'm not really very clear about that kasi it's the OPAP team who's in charge. What is clear that we've agreed with the private sector partners is that we just follow the prioritization criteria. So it's really likely that yung first two lang, no? Matapos natin yung healthcare workers, matapos natin yung senior citizens. Thereafter, the parallel implementation can really happen. Meaning, after the seniors, for sure, the private sector can get their stocks. Yung sa seniors lang na part, I think yun yung kailangan lang i-clarify.
Yes, ma'am.
Kasi kailangan yun matapos.
Senior, kasi nga po parang marami pang kailangan do we need to get all those 9 million vaccinated before the private can start their drive? Kasi parang yung priority 4 also is very important para to get going yung mga activities namin sa school. Tapos yung 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 ang confidence ng seniors to get vaccinated. Parang do we have a timeline na up to this period, kung wala nang pumupunta sa vaccination centers na seniors, despite all efforts, pwede na mag-proceed to the next?
Oo naman. Parang syempre the sooner that we get people vaccinated, and it's not like it's going to be there like entire year waiting for them. We do have, so at least for the healthcare workers now, the advice is like within 5 days, they actually have to complete. Diba? Dun sa entire So hindi to parang forever intayan din po. Kasi remember, by the time that we do the seniors na, kunwari May na po, then the second dose of the healthcare workers also are going to be due, di ba? Kung after 12 weeks yung AstraZeneca nila. So, magkakaroon ng patong-patong. So, it can't be like free for all, magulo yung nasa mga centers natin.
Kung ikaw healthcare worker, ayaw mo magpabakuna ngayon, sabi niyo po may 5 days sila to get vaccinated. Pagka ayaw nilang magpabakuna because ito yung vaccine, sabi niyo nga bawal mamili. So, will they be assured pa rin later on that hospital, that healthcare worker can receive vaccine in another day or schedule?
Or they have two choices already, di ba, ngayon? So, Astra and Sinovac. And the thing is, out of ethical obligation then among healthcare workers, we do have 1 million doses, but that's really just for 500,000. And we're talking about 1.8 million. So out of ethical obligation, if you don't want to get your vaccine, some other healthcare worker in another part of the country actually needs the vaccine. So kaya may timeline din, di ba? Because we need to ship out as early as possible to everywhere else in the country.
I also agree, Doc Dev, na if there's a population na dapat mauna din sa pagpapabakuna, it's the healthcare workers kasi it also increased trust from their clients, their patients. So if nakita nila na yung doktor ko o yung nurse ko nagpabakuna na, then baka dapat ako na din. So I think that will really be very much helpful sa vaccination program ng government. Opo. Hintayin din natin na our senior citizen government officials will also get vaccinated. So I think those are our questions for now, Doc Deb. But if ever may mga questions that will be asked later on, we'll just send you an email and if ever. But so far po, Doc Deb, we are very thankful for your time and your expertise. I know you're very busy. Thank you for gracing our webinar. We'll proceed with our second part with the private sector. Thank you for all that you do in our healthcare program in DOH. At mabuhay po kayo, Doc Deb.
Thank you very much. We actually wanted to thank you for allowing us to use your platform for this advocacy work as well. So maraming salamat po.
God bless, Doc Deb. Thank you. Okay. Now we'll proceed with part 2. Our second resource speaker is the Chief Resilience Officer and Advisor of the Philippine Disaster Resilience Foundation, the country's major private sector coordinator for disaster risk reduction management. And he was in charge of the establishment of its emergency operations center. We also know Sir Bill from Makati Business Club. Let's all welcome to talk about the PDRF's support to the COVID-19 vaccination plan. We all welcome Director Guillermo Bill Luz.
Thank you and good morning. Thank you, Joyce, for the introduction, and thank you to the officers and members of PACU for inviting me here today to speak about the private sector support for the COVID-19 vaccination plan. I'd also like, I know she may have left already, but I'd like to extend my thanks to Dr. Beverly Ho. We work a lot with her, and she's always good in explaining and answering questions on COVID-19 in general and vaccination campaign. So I'd like to focus on what we've done to support the government, IATF, the National Task Force, Department of Health, and other agencies with respect to the COVID-19 vaccination plan. Just by way of background, our our help in the private sector extends back to April last year, uh, when T3 was formed. So T3 is the task force on test, trace, and treat. And we started our work on lab licensing and PPEs back in April of 2020. And then since then, it's expanded to other areas of work, including the One Hospital Command, pool testing, all those other boxes that you see there, surveillance, health funding, healthcare worker hiring, and now working on the vaccine roadmap. So that's where we're spending the bulk of our time, though we still are taking a look at all these other aspects as well on a very regular basis. Uh, so the private sector, when we formed T3 with the government, we were able to assemble a very large number of private companies, and that number continues to grow as people get involved in the vaccination program. So everyone just divided themselves into areas where we could help, whether it happened to be PCR tests or PPEs or quarantine centers. But today, all of us are really focused on the vaccine program. I know Rizzi is going to present later on, so I apologize, Rizzi. I'm going to steal one slide from AC Health, but just to get the ball rolling on vaccines, sometime around September, October, uh, a group of companies started researching in depth the vaccine situation, and Ayala Health or AC Health was one of the earliest to get in and take a really deep dive into looking at the situation around uh, vaccine supply and vaccine demand. And they took the trouble to interview a lot of the global manufacturers of vaccines, but also talk to the local and regional industries, government agencies, and other experts, and began to provide us a really a clearer picture of what was going on in the vaccine world. We were able to then team up with groups like Unilab and Swilling Pharma, Boston Consulting Group, PDRF, and others to round out the picture, and we continue to get a more detailed picture uh, on a weekly basis. One of the first things we saw right away was that global demand. for this year, especially 2021, would far outstrip global supply. And a couple of factors. One is that, of course, it's a very new vaccine. It came on board actually earlier than expected, so no one thought that there would be approvals and phase 3 trials completed and reported out by end of 2020. But in fact, there were several, and we could see the order take off late in 2020 and into 2021. So we had figured that the demand would far outstrip supply and then only begin to balance sometime in 2022. Uh, we're still experiencing that tightness of supply, but we think that's going to correct uh, within the year and certainly into next year. And the reason will be that some countries have over ordered supplies, so they have, because they didn't know which vaccine was going to become the one that, the ones that would pass phase 3 trials and get the EUAs and the FDA licenses. But so some countries ordered, 3, 4, 5, 6 times the amount of vaccines that they actually needed for their population. So with all that surplus, we feel parts of it will re-enter, back into the world market. The other is that, you know, uh, countries do change their minds on which vaccines they're going to eventually use. So, uh, with some adjustments in their consumption patterns, that should also free up some supply. So one of the things we did was decide how could the private sector work with the government and help the government across certain key functions, part of a strategy for a short term and a longer term strategy for the Philippines. And we settled on these 6 items. One, we take a look at commercial procurement. Two, look at logistics and distribution. Three, the technology requirements. A lot of IT was required for tracking and record keeping, both of the supply and the vaccinees, the vaccination itself. Fourth was a communications program. Fifth was a long-term manufacturing program, which I will talk about a little later on. And then sixth was the funding requirements, because government had to somehow budget for it. And I think you heard Dr. Beverly talk about uh, the budgets coming from a combination of COVAX and loans from World Bank and ADB, and of course the country's own national budget. So that had to be addressed as well by the government. So we focused on these items, particularly items 1, 2, 3, 4, and 6. And in order to do that, we created a team within the private sector, and the ones I mentioned already, AC Health, PDRF, UD Labs, Willing Pharma, and then we brought in Boston Consulting Group, or BCG, to provide us some global expertise and a management consultant point of view. We're able to, of course, count on the entire Task Force T3 for uh, support and for assistance. And we teamed up with the government side through Secretary Charlie Galvez, and as the vaccines are, and his team. And his team is composed of we had many on his team, but the principal players we work with are Undersecretary Mirna Kapotaje at DOH. She heads the allocation and administration and site mobilization work. So all vaccine administration falls under her. And then USEC Undersecretary Carol Taino, she heads all the logistics, supply chain, distribution, and cold chain management part of the vaccine program. And then Director General Ramon Kualoping at PIA for the communications and the public uptake. So once we got that coordinated, we decided how can we help, and we figured on these sort of, I guess, 4 key types of work that we would do. One is we would help set up the vaccine operations war room, work with the staff, bring in private sector partnerships to work with the government people in the on the task force and the task groups. So the basic vaccine operations center. Second is that collectively and individually, each of the companies had some access to global expertise, global knowledge, whether it was Unilab or Zwillig or Boston Consulting Group or Ayala, could pull in all this information, and we bundled it together so we could bring some share some of this knowledge with the government, and then with private sector people, we teamed up with the government to help in trying to solve specific challenges, specific problems around the topics I mentioned, procurement and logistics and IT and administration, things like this. And then we tried to um, work closely with government to uh, push a certain pace, and the time was short, so we had to work very quickly and orchestrate a lot of moving parts to try to get everyone to be ready in time for March, which is what we had to do because the vaccines would start arriving in February or early March, and they started arriving exactly February 28th, and the first week of the rollout was last week. So with the staging of the war room for Secretary Charlie, he had task groups. So these are the four key boxes at the third level: procurement, allocation, distribution, and communications. And for three of them, we had a we played a direct role or engagement by placing private sector people in the allocation and administration task group, the distribution and supplies task group, and the communications and public uptake task group. The procurement side was adequately described by Director Bev, no? In terms of all the multiple layers of FDA and HTAC and the vaccine expert panel and all these groups, which are evaluating uh, what the government should procure, and they made that decision. Our recommendation was to follow a portfolio strategy rather than stick to only two types of vaccines or two brands. We recommended looking at maybe half a dozen brands so that we could get supply from enough supply for the country, and also we could sort of protect ourselves against risk that we would not be able to procure enough uh, vaccines. Uh, so aside from the three boxes in yellow where we put private sector people, on the side you can see the support boxes like IT, funding, legal, regulatory, and vaccine evaluation. We participate heavily in the IT systems, data, and tracking side of things. Funding and budget is pretty well all government. Legal, regulatory is all government, and the vaccine evaluation fell to the government, of course, as part of their procurement work. So these groups below work regularly, and we have very high and active participation by the private sector. And the type of work within these three streams is the private sector support comes through below here, whether it's private hospitals and clinics and spaces, uh, to logistics, cold chain, air and sea freight, trucking services, IT providers, so on and so forth. And then on the communications and public uptake, we're able to uh, recruit ad agencies, media agencies, PR agencies, production houses to help in create the materials that the government would be needing and that the private sector would be needing for communications, vaccine communications. So where we kind of fast forward from October and all the work that we did, and that continues, where are we today? And this slide I share from BCG, where we are today. And every week we kind of try to go through an update with Secretary Charlie and his team, Yusek Kapotaje, Yusek Taino, and the rest of the team, what's happening in the world and what could we learn from. So definitely the vaccination campaigns are ramping up rapidly around the world. 300 million doses have been given, 300 million plus. Daily pace is about 7 million, but this is heavily skewed towards developed countries. I think the top three or maybe the top four, five countries at most account for roughly 70% the vaccinations done so far. So these countries like U.S. and UK and others, China would be up there in terms of vaccinations, and then the rest sort of trail further behind. Uh, COVAX has now started to move supply, and that was a little bit delayed, but it has started. And for the Philippines, it started last week. And this is a bit dated. So March 8th, 29,000 doses administered to Philippines. It's actually now closer to, it's about 50,000 doses uh, administered in the Philippines, and uh, more than 384,000 doses now delivered to the vaccination sites from the grand total that we have received. So we track this on a daily basis. There were some initial restrictions in Europe for AstraZeneca for elderly, but that's been looked at again, and some countries are loosening up. Uh, a lot of the restrictions had to do with the lack of data, not any fear that something went wrong, but in the absence of data, they decided to be a little cautious. But as more data and as the needs arose, then they decided to loosen up and allow the vaccinations. And uh, as already alluded to, we can see in countries like the UK and Israel that the number of hospital admissions among the elderly have dropped significantly for the over 80s and even for the over 60s, over 65s, and that the so it's not only hospital admissions but deaths have dropped as a result of the vaccinations. And the drop was noticed already at the first dose, not even at the full second dose, where you get to you should be able to feel the effects of the full efficacy. So you can see that the countries which used to restrict AstraZeneca use for over 65s have started to loosen up. France, Sweden, Germany. But there's still some confusion and misinformation. So this will take time to roll out. I think a big new development is J&J has begun distribution, and this is a game changer because this is a single jab, single dose vaccine. Everyone else is a double dose vaccine, so that complicates the administration side. Um, India is speeding up its vaccination drive and is tapping into the private sector of India. So a little bit what we're trying to do here uh, for the Philippines, and there is well not a little. There's quite a bit of hesitancy among Filipinos, and both SWS and Pulse Asia survey every few months. And so we do notice within the surveys and anecdotally, there's some concern about vaccinations. So that's where we are. Um, just to show you here, though, that one thing good is that uh, more and more vaccines are being approved and distributed around the world. So this is a very rapid change, considering that just 6 months ago there was hardly any vaccines were just being introduced, just passing their phase 3 trials, and just beginning to get their licenses. But now you can see they at least have emergency use authorization in many countries, and some are getting fully licensed. So that's good news. And if you take a look at the number of doses, as I mentioned, uh, these are the top brands, but you can also see in the map which are the countries that have the most vaccinations, and many of them happen to be the developed countries. And over 120 countries now have begun to administer vaccines. But you can see that the Philippines is just at the back edge of that pack because we only started on March 1st, so literally 10 days ago. So here's the Philippine update. I think the first thing to remember is that we have enough vaccines for the Philippines. Under consideration, there are these brands: Pfizer, AstraZeneca, Moderna, Novavax, J&J, Sinovac, and Gamaleya. And both Pfizer and AstraZeneca have received their FDA, and I think the others are going to be coming on quite soon when I take a look at Moderna, Novavax, and J&J. Uh, Sinovac, I think, has of course received some level of permit for donated medicines because it's in use since last week. So the total number of doses in the pipeline for the Philippines is in the range of approximately 148 million doses. And if you add the COVAX, that will move up significantly around between 170 to 184, 190 million doses in the Philippines. That could all arrive in 2021. There might be some slippage from month to month or week to week, but these are what is scheduled for 2021. So I guess my main message is there are actually enough vaccines, and they have started arriving. So the 600,000 Sinovac came in Feb 28. About 500,000 AstraZeneca were delivered on two dates, March 11th and 14th, and under the COVAX facility. So this is not yet the AstraZeneca procured, the procured items is through COVAX. And the expectation is that there should be another 4.5 million more expected between now and May, still under COVAX. COVAX is important because this is part of the WHO, Gavi, CEPI consortium. It accounts for between 3 and 20% of our population. So it could vaccinate up to 22 million people. That's 44 million doses. Uh, it is free or heavily subsidized depending on the volume of vaccines that you eventually receive. And for the initial doses we've received, it's healthcare workers which are being vaccinated. So seniors are not even being covered at the moment. It is healthcare workers. Week one rollout, so it started March 1st, and the data we have up to yesterday or the day before, yesterday I think, is approximately 50,000 people have been vaccinated with the first dose. The good news is adverse effects are very low. It's 0.8%, and they're all pretty well minor cases on the adverse effects. And even though there's some concern about vaccine hesitancy, outright refusals are still only 0.12%, so very extremely low. But I think you have to remember these are healthcare workers. So uh, healthcare workers, you would think, would want to get vaccinated because A, they know the most about vaccines and about the science behind it, but B, because they're frontliners, it's in their interest to get vaccinated. So we have very few refusals in that sector. And then the third part is the private sector and LGU engagement. Private sector and LGUs have already ordered alongside national government to augment national supply. This has happened for AstraZeneca, Moderna, and now Novavax. And I think Manolet can speak about that a little later on for Unilab. The private sector is also prepared to help in vaccine administration of economic frontliners as well as general population. So there was some discussion earlier about all the priority groups, A1, A2, A3, A4. The private sector is prepared to go parallel and accelerate the plan for that. And LGUs themselves are preparing their master lists against and DOH is prepared, as you already have seen, the priority targets of the population in their A1 to B4 lists. So what are the challenges? As I mentioned, there's enough supply. Administration is the challenge. The actual vaccination, it's one thing to receive boxes and boxes uh, of vaccines. It's another thing to get them jabbed in people's arms. That's a whole different type of deployment and challenge needed. And we need to match the supply and demand locally across uh, roughly 4,500 vaccine sites. And this is tricky because if one site has surplus vaccines and another site has a shortage of vaccines, we need to be able to figure out how to balance it so we don't waste the vaccines. Uh, the other question we have is like, do we have enough personnel? The government normally talks about LGUs supervising all the vaccine sites, about using the public health system, We've calculated that we need 52,000 people to really man all these vaccine sites, and the public health system does not have 52,000 people. They will have to use the private hospital and clinic system to get involved. There's just no two ways about it. Uh, do we have adequate ancillary supplies? The vaccines are useless without all the needles and syringes and PPEs, etc., to go with it. And so there must be a perfect match between the ancillary supplies and the vaccines. So if we have 148 million vaccines uh, coming in, we have to have more than that ready in terms of ancillary supplies, especially of needles and syringes, of course, no? Not so much the PPEs. The fourth challenge is we need a national database of vaccinees. Uh, so people are preparing a master list, but we somehow have to keep track of all that, not only at the LGU level, the corporate level, the hospital level, but it's got to be put together in a national database. And it's important because we need to get people back for that second dose. Uh, if we're not able to get people to return for the second dose on time, then I think we're not going to be taking full advantage of the efficacy that these vaccines are known for. Uh, and related to that, we need a data system and dashboards. And the data system not only tracks the number of people being vaccinated, but tracks all the inventory of supply for both vaccines and ancillary supplies as it goes through the system. Because it's one thing to distribute it, but you have to do the reverse logistics and collect all the waste back. No, I also already mentioned this, the vaccine hesitancy. These are survey data from last year, November, September 2020. You can see that for both Pulse Asia and SWS, uh, you have a number who say yes, but it's not the plurality even, no? And there are a lot of people who are no or undecided. So we've got to be able to turn that sentiment around. And then as people get vaccinated, you've got to issue some sort of a vaccine certificate or pass so that we know who has been and who hasn't been vaccinated. And eventually, I think these need to be internationally acceptable for travel. And we need to guard, of course, all the data allows us to guard against black market vaccines and counterfeits. Uh, while we're thinking of all the groups that need to be vaccinated, and I know it's a policy to vaccinate everybody for free, but we need to think of special groups. I think micro, small, and medium scale enterprises, the informal economy. These are important because we can't get the economy running and up and going if we don't pay attention to these groups. And typically, these are among the groups who really can't afford uh, to pay for vaccines or vaccine administration. So that's some of the challenges moving forward, and this is what we try to address on a daily and weekly basis with the government. Uh, we have seen some, early lessons, and I'll just itemize a few of them. Good practice from around the world. Multi-channel booking systems. So the appointment setting is is important. Uh, we're only in the first week, so the appointment setting is pretty easy. That's only healthcare workers, and they're right inside the hospital. The real challenge is when we get moving to seniors and all the other groups, because obviously they're living at home, and how do we get to them? The best systems we've seen around the world involve either a combination of phone calls, text, uh, reminders, apps, so on and so forth. So relying on only a single channel is not as effective as going multi-channel. The vaccine sites have to be really well located, and they have to be attuned to different cohort groups from an accessibility point of view. So, since we're not doing home service, you've got to set it up such that they're accessible or people can be shuttled into these centers relatively easily. Um, the country has been planning mostly a single shift operation, but some of the countries that where we have seen them move fast have gone into 24/7 operations uh, rather than single shift. And like I say, the Philippines is planning mostly single shift. The flexible inventory management has been critical because, as already pointed out, there's a possibility where a vaccine center has excess vaccines because Not the number of people expected for the day is below what was forecast or what where appointments have been set. So we need to have flexibility. And I know DOH, Dr. Bev showed the chart as to how it moves across from one group to another group if people don't show up. But we're going to need a lot of flexibility and speed to be able to move to different to what they call the quick substitute lists so that we don't lose vaccines. One thing you have to remember is when the original plans were made of the government, it was made on the basis of scarcity. They thought kulang ang vaccines, but actually there's enough. So I think the focus should now be on speed. Affordability free of charge, I think that's not a problem for the country because that is the policy of government. They just need to procure the vaccines actually and administer it, and then some form of incentive. In the case of Israel, they used a green pass or certificate, a vaccine certificate that you can show that allows you to move around. So far, I'll summarize what the private sector has recommended and the actions we've taken. We've augmented national government procurement of vaccines. And remember that every dose purchased by the private sector eases the burden on government. And as Dr. Bev said, it is voluntary, and a lot of companies have volunteered and bought. And they've started with AstraZeneca and Moderna, and then Novavax will be coming on stream anytime now. So that's moving. Uh, Third-party logistics providers can handle vaccine supply chain management and distribution to vaccine hubs and centers. The private sector will use third-party logistics providers, and the government is also using third-party logistics providers, and we'll need to make sure that all those contracts are out in time for delivery of all the vaccines coming in, the 148 million vaccines. So that's a big contribution of the private sector. The private sector can also complement or augment vaccine administration by using private hospitals, clinics, and sites. Because as I mentioned, there will not be enough healthcare workers in the public health system to be able to handle everything. And even under regular vaccination programs like measles and dengue, private physicians are already used. So all the more reason we need to use a the larger private hospital system to help out. Uh, we can help also accelerate the vaccination program because we can inoculate our own employees, household dependents, partners, contractors, and subcontractors. And we can do this in parallel with the government so that we can reach out to more people. We can, if we go with speed and scale, we will get to herd immunity much faster together than rather than running sequentially using the A1 to B4 or B3 system. So we've got to move uh, parallel rather than sequential. We can help design and build data systems and dashboards for both public viewing and executive decision making. Some third party logistics providers already do this both for supply and for vaccinee information. The government is a little behind schedule on these data systems and dashboards. So we're putting on a lot of effort to try to get this up to speed. Uh, Not too visible now, but working quietly in the background and ready to roll out, is the private sector has assisted in creating a public information campaign to encourage vaccination and to counter vaccine hesitancy. This is the program called Ingat Angat. So that has run for COVID earlier on, but now we'll move to its vaccination phase. And that program, all the creatives are being put together, and the private sector is actually contributing to the funding of the creation of all the materials. Of course, the ad agencies and PR agencies, suppliers are also helping in giving very heavily discounted fees. So, private sector generally has been an active partner of government in the NDVP since day one, back to the T3 days in April 2020, and we've accelerated it through the campaign program. So the way forward is we want to expand, of course, public-private partnership. We need to focus on opening up the economy safely and quickly. So speed and scale are important, and this includes the educational sector because we can't open up the educational sector if we don't get teachers uh, vaccinated. And teachers are in the I think at the B1 category. So we would love to see them moved up. We need to take a long-term view because we're completely dependent on importing everything at the moment. When I say everything, I'm talking not only vaccines, but actually for a while, virtually all the PPEs we had are imported, ventilators, test kits, everything. We have no local industry for this, so we ought to seriously think about it. And we have a lot of policy in place, but bottom line, execution matters, and I think it's all about good execution. So let me just close with some numbers. Uh, if you take a look at the Philippine population, we have 77 million people age 18 and above. That's 70% of the population. So you can estimate it between 70 million and 77 million. If we were to do that in 6 months, 12 point that we would need to vaccinate 12.8 million people per month for 6 months, or 428,000 people per day. Divide that into the vaccine sites, and that's roughly 100 people per day. But remember that all the vaccines require 2 doses. So obviously, we're not going to be able to get all of this done in 6 months. And if we were in a more likely scenario is 12 months into 2022. What worries me with the sequencing, where after healthcare workers, we still have to do 9 million uh, seniors before we touch anybody else. 9 million seniors, even at 250,000 a day, which is quite an achievement. Huh? We're not anywhere near 250,000 vaccinations a day. Would take more than a month. And if we are falling below that, then we're talking 2, 3, 4 months before we begin vaccinating anybody. But remember, supplies are arriving. So as supplies pile up, we're going to start running into difficulty with expiry dates, with spoilage, with lack of storage. So I think we should, in anything, accelerate the administration and the vaccination rates by expanding simultaneously into the other groups, A1, 2, 3, 4, and then B1, B2, because once the vaccine starts coming, we need to consume. So let me illustrate. Last week we received 1.1 million vaccines, and as of yesterday, I think the numbers are showing, or the day before yesterday, numbers are showing 50,000 vaccinated. Of course, the 1 million had to be distributed around the country first to the vaccine sites, but still, you can appreciate how much more we need to pick up the pace if we're going to hit the numbers we need to hit in order to reach herd immunity. So that's just to show you. I want to illustrate again. There are enough doses in the pipeline. The challenge is administration, and in the pipeline we have all these brands coming in. So let's focus on administration. That's where we can help. Thank you.
Thank you so much, Bill, from PDRF. We really appreciate that very timely and very informative and exhaustive update on P3, test, trace, and track. We thank PDRF and the entire private sector for complementing the national vaccination program, and working in parallel with government is really the way to go to assure speed and scale, as Sir Bill has mentioned. And we really hope that we do this faster, more agile, so that we get the target population vaccinated within the year, and next year we'll finish everyone. So okay, to proceed with our third speaker, to talk about the Covavax vaccine is the Vice President of the Unilab Vaccine Initiative. Let's all welcome Mr. Manuel L.
Good morning. Thank you to Paco and Anthony for allowing us to share what Unilab has been focused on in the past year, and specifically our vaccine initiative. So as was mentioned by Bill, the private sector has been working very closely with the government throughout the pandemic. And so our aim is to really partner with the government and with other private sector partners, really to get the country back on its feet. And specifically, companies have certain expertise or resources, which we, I guess, all try to contribute and to come together in order to bring the country, out of the pandemic. And so I'd like to share the specific initiative around the vaccine. So Unilab has helped in the testing and other forms throughout the past year. But this specific initiative relates to bringing vaccines and making it available to the private sector. As was mentioned, there are several initiatives with AstraZeneca, Moderna, which the private sector has been able to access in line with the national government programs. So this is another channel whereby the private sector can avail to bring vaccines to the economic frontliners primarily. So you might see several names connected to what is most commonly known as the Novavax vaccine. So, but the brand name is actually called Covovax. And there are several parties involved in Covovax. The first one is really the developer. So Novavax is a US-based company out of Maryland. And they've been in this sector for over 30 years now. And so they've also developed the other vaccines, and they have a very promising one, in fact, for influenza also. And they had a very promising early on vaccine, COVID-19 vaccine candidate. And when the US government was looking at various options in order to accelerate the clinical development of different vaccines, they were one of the companies which were approached, and the US government, as part of their Operation Warp Speed, invested over $1 billion to accelerate the development of Novavax vaccine. And that has really paid off. And the fruits of that is that it went through the phase 1 and 2 clinical trials, and phase 3 data came out early this year from a UK study, which showed quite promising results. And my colleague, Dr. Nancy Bermal, will share more information about the science. Now, to bring this promising vaccine to the world, Novavax has partnered with various manufacturers and partners all over the world. And so whether it's in Japan or Korea, or in India, or in Europe, there are several partners whom they've tapped to produce the vaccine. So in our part of the world, actually, we're quite lucky that the Serum Institute of India is their chosen partner, because they're the largest vaccine manufacturer in the world. And so, outside of COVID-19, a vaccine from SII is used most. I think 60% of all vaccines in the world come from SII. So they have very high capability in terms of manufacturing, and the quality is known to be very good. So in the Philippines, Faberco Life Science is their traditional partner for their other vaccines. And considering the scale of this effort, also now Faberco has partnered with Unilab in order to together bring this Novavax or Covovax vaccine to the Filipino people. So there is, as was shared earlier, a government initiative to bring this 180 million vaccines into the country. And Novavax is part of that. So there's about 30 million doses of Novavax, which is part of that. This effort now is in parallel with that, for Unilab, because the whole effort of Unilab is to focus on the economic frontliners. We're making available Covovax really together with the government efforts. So it's definitely not in replacement of, but it's in parallel and augments the government efforts. And any distribution which had been discussed by both Dr. Beverly and Bill, this prioritization and the guidelines are however they end up in terms of being finalized, and they are a bit in flux. But whatever the eventual guidelines are, that's we would follow that. And I think Bill has emphasized that there is constant communication between the private sector and the government also to harmonize what is best for the country. And so we would definitely follow whatever those final prioritization and guidelines are. I guess while we are a pharmaceutical company and have been in this area for 75 years and have an existing vaccine lineup, we treat this quite separately. So this is not a part of our business. We recognize the unique situation that the country is in, and we have some resources which we can help. And one of that is really to bring this vaccine. And we don't treat it as a business. So this is something separate from our other, and it's not run through one of our divisions, but really as a separate initiative where we can provide a service to the country and making it more available. And I'll describe some of the partnership terms that we're proposing, where companies really are able to partner with us if they like, to serve their employees or even the dependents of companies. I would very briefly share some highlights of the vaccine, and later on, Dr. Bermal will share the science and the clinical trials. As a company, we very much believe in health and in science, and so getting involved with this particular vaccine was as part of our process. Of course, we definitely study the clinical data and the science behind it, and we'd like to share with others also and our partners insights in terms of the clinical data and the science behind it, also to give confidence to the population and to the deciders that these vaccines go through a very rigorous process, and it shows that for those that make it to the final hurdle, where the experts and in the FDA or the DOH, they are able to look at a very robust data. So Covovax itself is as you know, there are many types of vaccines, but this type of vaccine is what they call a subunit vaccine, and it is partnered with a proprietary adjuvant, and so it's just something that you add on to the subunit protein, and so that the immune response is going to be accelerated, so you get a higher level of immune response. The dosage administration, I think people ask us that, is similar to the other vaccines that are initial ones that are available. There are 2 doses which will be required per person, and after the first dose, it requires 21 days after that. And so there is a window where you can get the second dose, to 28 days, at least in terms of the study design. But it would require 2 doses. I think one of the benefits of in the way that the trial was run is that it included some elderly population also. So in fact, the age that was studied in the clinical trials was up to 84 years old, which is I think a new segment also that was studied, and so it adds on to the overall information we have about the vaccines, and I guess gives confidence also for that sub population. The transport and storage requirements is also something that is, I guess, friendly to our infrastructure and to countries like the Philippines. So it requires a 2 to 8 degrees, which is the normal refrigeration. We feel that it will also, this is beneficial, especially as you go beyond the major cities, where you're able to store it and distribute it more easily, and the country's infrastructure is able to support that. Our projected supply date is starting July, the third quarter. Is where most of the big bulk of the volumes will start to arrive. Although there is a possibility of late May, and so we're definitely keeping our fingers crossed and hoping for that. But we, as it stands, our base case is in July. As you've seen with other vaccines, there are many moving parts to this, whether it be regulatory or supply. But our best estimate at this point is July, with a possibility of May. In terms of the partnership with the economic sector and the private sector, we've designed it in a way where we wanted to make it more accessible to more people. So first is the cost. We have an indicative cost of 1,000 pesos per dose, and remembering that each individual would need 2 doses. And what this would include is the actual vaccine, the supply, which we would take from its delivery at the airport. We would store in our facilities, in our warehouses, ensuring that there is the supply chain and logistics and warehousing that ensures that the cold chain is integral. And we would deliver that to the hospitals, which are the vaccination or administration points. We do say that we're aiming to reduce this cost. We're hoping that we can bring this down. So this would be a maximum. I think we're finalizing also our discussions with the manufacturer and our other partners, looking for efficiencies. And that final price we can reflect when we get a little further in the process. But that would be the maximum price, and we're hoping to bring that down. And as we bring that down, we would pass that on to the companies, and because the whole principle is really, for us, this is not something where we would make a profit on. And so we pass on those savings. At the same time, we ask the same of our partners. So if we're going to partner with a company or a school who signs with us, the ideal is that they provide it for free to their employees or dependents. But of course, not all companies or schools are able to do that. And if they include, others who are not able to pay for it, what we ask is that there's no markup as it's passed along to those individuals, so that it is passed on to them at cost. We have set up a system where currently we can sign term sheet agreements with companies or schools, in your case, where there is a commitment to purchase from your end, and on our end there's a commitment to supply. and eligible are all companies, and this is for their employees and for their dependents. And as we move further beyond that and we get more details, we would be able to execute a purchase agreement in 1 or 2 months' time, and that would be the next stage of it. And so companies or schools who are interested, they can contact the email address that we have here, our Unilab consumer care line, and you just indicate some details about your company, the number of doses that you might be looking into, and then we can get back to you to share with you more details, and that may lead to a term sheet agreement that we both parties could sign. So again, this is overall what we're proposing. I think I'll add that the minimum order quantity is just 200 doses, so just for 100 individuals, which I think hopefully also makes it more accessible, especially to the small and medium-sized enterprises, even micro enterprises, where more people hopefully can access the vaccines, and we can together bring the country out of the pandemic. Okay. So thank you very much.
Our next speaker, also from Unilab, is a fellow of the Pediatric Society and board of director of the Pediatric Infectious Disease Society. She's also a part-time faculty at PLM, or Pamantasan ng Lungsod ng Maynila College of Medicine. She's also past clinical trialist for pediatric and rabies vaccine. Currently, she's the medical director of Unilab's Vaccines and Diagnostics. Let's all welcome Dr. Nancy Bermal.
Yes, so thank you so much again for this invitation to share with you about the Covovax safety and efficacy profile. So these are my disclosures, and this will be the outline of my presentation. So as mentioned earlier, Covovax is the COVID-19 vaccine that's developed by Novavax. And what the company did is to get the spike protein of the SARS-CoV-2 virus and mix this with an adjuvant to enhance the immune response from these vaccines. Especially this adjuvant will have an impact on better immune response, especially among the elderly and those with comorbid conditions. So the final formulation of Covovax vaccine is it contains the protein subunit, specifically the spike protein, and mix it with an adjuvant, which is premixed. And this formulation is stable in the standard refrigeration of +2 to +8 degrees centigrade. So just sharing with you the clinical development that is being undertaken or has been done by the company. I think this is important to share with everybody because one issue for the decrease in confidence in vaccine is the concern that minadali daw ang pagdevelop ng COVID-19 vaccine. So sharing with you about the clinical development for this Covovax vaccine. So it underwent study phase 1, phase 2, phase 2B, and then phase 3 trials. So we know that for phase 1 and phase 2 studies, the primary objective of why we do this study is to look at the safety and immunogenicity of that particular vaccine. So safety data is very important because we know that we give these vaccines to individuals to protect them against COVID-19. So immunogenicity is we measure the immune response or the development of the antibodies that will be triggered by giving these vaccines. So aside from these antibodies, the vaccine should be able to demonstrate also the durability of these antibodies, how long will it protect an individual, and also its ability to develop immune memory from this antigen or from this vaccine. So these are the different trials that were undertaken by the company. So for the phase 1 and phase 2 studies, so we know that for phase 1, so you only enroll 100 participants and the age group will be limited to, for this particular one, it's 18 to 59. So they proceeded to do the phase 2 trial also in Australia and now involving some participants in US. So they have enrolled 1,200 participants, and this time they have expanded the age group up to 84 years of age. And then we'll be sharing with you the data on the phase 2B South African trial and the phase 3 UK study, where aside from safety and immunogenicity, efficacy assessment is also included. And we will be sharing with you the update on the big US trial where they have finished enrollment, 30,000 participants. So aside from this phase 1, phase 2, 2B, and phase 3 studies, the company also is doing a bridging study. So these are the green here, the study that will be done in India as well as in Japan. This is in collaboration with Takeda, so that there will be technology transfer from the Novavax to Takeda in order to manufacture and distribute this vaccine to Japan. So in Japan, they'll be doing all phases from phase 1, phase 2, and phase 3 before they can get approval to be used for Japan market. For India, so another bridging study will be done. So that will be a technology transfer again to the Serums Institute India. So, but this time it will be a phase 3 study in order to assure that the quality, the safety, the immunogenicity of the vaccine that was developed by Novavax and then tech transfer done to this manufacturing companies will provide same safety, efficacy, and quality of vaccine. So yeah, just for transparency, you can go to the Novavax website if you want to know further about the protocols, about the detailed results of this phase 1 and phase 2 study and the preliminary data from the phase 2B and phase 3 trial in UK. So the phase 1 study that was done in Australia, so we said it's, the objective is to look at the safety and immunogenicity. And from this data, the conclusion was the vaccine is well tolerated, meaning the safety profile is acceptable. Majority of the subjects reported none or just mild adverse reactions. Usually they had pain at the injection site, tenderness at the injection site, fever, muscle pain, fatigue. But this adverse reactions are mild and usually resolved after 2 days from receiving the vaccine. There were no adverse events of special interest, and there were no serious adverse events which caused suspension of the trial. So from this data, we know that the vaccine has a very good safety profile. And then the immunogenicity, that's another objective of the study. From this trial, 100% of the participants had seroconversion rate, meaning they develop antibodies, so they get the baseline and then they get the amount of antibodies after receiving the first dose and after receiving the second dose. So everyone had seroconversion rate. And aside from this, important data from phase 1 is the vaccine, the Covovax vaccine, has the ability to elicit strong T-cell response with together with the adjuvant. So the importance of this is the immune memory response is demonstrated. This is important. So we will know that, once a person has been exposed to the virus and got the Covovax vaccine, so the person will have enough antibody, and also the immune memory cells will also come into play to also enhance the production of the antibodies to provide, protection from COVID-19 infection. So this week, we can say that the adjuvant that was added to the vaccine provided optimal immune response. So from the phase 2 study, this time included were elderly population, and 50% of this, more than 1,000 participants belong to the elderly age group. And from this data, we can say that the vaccine was well tolerated with local and systemic side effects, which are mild, lasted only 2 days after the vaccination. But similar to the other vaccines, the adverse reactions were attenuated, or there were more adult participants who developed these mild adverse reactions. But there were no adverse events that caused suspension of the trial, giving us the confidence that the vaccine moving to the phase 2 trial has very good safety profile. And from this phase 2 study also, they did the dose finding. So in doing vaccine trial, so you have to know what is the optimum vaccine dose and even the interval between the 2 doses where the maximum antibody response can be elicited. And from this phase 2 study in US and Australia, the company was able to determine the optimum dose and even the interval, which is the 5 microgram of the spike protein plus the 25 microgram of your matrix M adjuvant, given 2 doses 21 to 28 days apart. So at least we will know that, the company did this clinical trial in order to come up with the final formulation that will be used in their phase 2B and the other phase 3 trial. And eventually, this will also be the final formulation of the vaccine that will be rolled out globally. So these data are all published in peer-reviewed publications, such as the Journal of Infectious Disease, Vaccine, Science. So any one of us can take a look at this publication. And for transparency, this is really very important for us to really understand the science behind this Covovax vaccine. And then from this phase 2B in South Africa, so I mentioned aside from safety, immunogenicity, and then also efficacy. So from this study, they enrolled 4,400 participants, including those with HIV. And they were able to share with us the preliminary results of this study end of January. So what is also important from this phase 2B study in South Africa, at the time that they were collecting the primary endpoint, which is the number of participants given the Covovax and given the placebo, those who will develop PCR-confirmed COVID cases, whether it's mild, moderate, or severe. So at the time, the predominating circulating strain was the South African variant. So what's the data? So from this phase 2B study, so the overall efficacy of the vaccine is 49.4%, given that 15 participants who were given Novavax developed COVID and 29 developed COVID, those who received placebo. So when you say primary endpoint, this includes all the participants, whether they are young, whether they are adult or elderly population, whether they are HIV positive or HIV negative. So the overall efficacy is 49.4%. But when they did subgroup analysis and only included those with HIV negative, so the overall efficacy was 60.1%. So you can look at the number of participants who were given Novavax and placebo. So what is also important in this South African study 93% of the total PCR positive samples were attributable to the South African variant. Okay? And from this study also, there was one participant who received placebo and was diagnosed to have severe COVID, but none in the Novavax group. Okay. So with that data, we can see that there is cross-protection against the South African variant strain. So for the phase 3 studies, the company is doing 3, the United Kingdom, the UK study, the US and Mexico, and then the bridging study in India. So for the UK study, they have enrolled 15,000 participants, and 25% of this belong to the elderly population. And if you look at the number of participants who got the vaccine and also got the placebo, they're equal number. So all of them received the Novavax group, received the Covovax 2 injections, 21 days apart, and the placebo group also received 2 injections 21 days apart. So the primary endpoint of this study is also to look at the number of participants who will develop PCR positive, symptomatic, mild, moderate, or severe COVID illness, diagnosed more than or equal to 7 days after the second dose. So parang ganun po yung gagawin, no? Invite participants and then randomize them to receive the Covovax or receive the placebo, and then monitor these participants 7 days after they receive the second dose. How many of them will develop symptomatic COVID illness? And from this data, total of 62 out of the 15,000 participants, this is based on the interim analysis, develop symptomatic COVID. And if you look at the breakdown, there were 6 participants who had symptomatic COVID who received the Novavax, and 56 received the placebo, which gives the vaccine efficacy of 89.3%. So again, this is overall vaccine efficacy. So from this data, so we can see that the company was able to achieve at least 50% of the agreed number of PCR positives, no? Kasi from this protocol, they need 100 cases in order to say that they were able to meet the primary endpoint. So the data that I'm sharing is 62 positive cases. So looking further into the gene sequence of all these participants who develop COVID, whether they receive Novavax or placebo, so we can see that among those who received Novavax, 4 had the UK variant strain, and only 1 had COVID due to the ancestral strain. So we can say that the vaccine has a 96% efficacy in preventing ancestral COVID due to the usual COVID-19 strain against all types of COVID infection. But if you look at the efficacy against moderate to severe, it's 94% when we talk about COVID due to the usual strain. But if we talk about the efficacy against the UK variant strain, so overall, it has 86% efficacy and 87% efficacy against moderate to severe. But since there were no participants who developed severe COVID, we can say that the vaccine has 100% efficacy against severe COVID. So the data from the South African study and the data from this UK study can, tell us that clinically, Novavax has data to show the cross protection that the vaccine can provide in protecting against the variant strain. Now, another important information that we want to know is how safe the vaccine is. So looking at the number of patients who develop severe AEs, who develop serious AEs, and who develop medically attended AEs, you can see that the numbers are comparable between those given Novavax and those who received placebo. And as I mentioned earlier, from the phase 1 and phase 2 trial, the vaccine is well tolerated. Majority of the adverse reactions were mild. There were no severe AE. And these are the common reactions such as headache, fatigue, and muscle pain, which are the usual adverse reactions that we can experience after receiving the flu vaccine. So moving on to the big US and Mexico study. So they have finished enrolling 30,000 participants. So but this time, 20,000 were given the Covovax vaccine and 10,000 were given the placebo. It has similar primary endpoint as the UK study, but this time they need 144 positive PCR confirmed COVID, whether it's mild, moderate, or severe. So what we can share are the profile of these participants. So they have enrolled diverse population, Latin Americans, African American, Native Americans, even Asian American, and 13% of these participants belong to the elderly population, 65 years and older, and those with comorbid conditions. So why are we emphasizing that we also reviewed the profile of these participants? Because we know that this age group, the 65 and above with comorbid conditions, these are the vulnerable population which can get severe COVID, which can lead to hospitalization and even death. So we need to demonstrate the safety and efficacy of this COVID vaccine among this population. So addressing the problem of the circulating variant strain, and also some question how long does one get protection if you receive Covovax. So part of the development plan of the company is to also develop multiple strains of COVID-19 vaccine or Covovax vaccine. So similar to our flu vaccine, we have trivalent vaccine, we have quadrivalent vaccine. So Novavax is looking into developing generation 2 COVID-19 vaccine by including relevant strains. So now we know in the Philippines, the UK variant strain is circulating and even the South African variant strain is circulating. So we will have information if the company, although now we can say, based on the data from UK, that there is cross protection against the UK and against the South African strain, but we will have information that eventually, once these strains will really be the predominant strain, the company will be including this other variant strain in the generation 2 Covovax vaccine. And they are expecting to do clinical testing by Q2 of this year. And as far as the booster vaccine is, if it's really needed, the protocol for the phase 3 trials will have 12 months measuring the antibody responses. So we would know if indeed a booster dose will be needed after a year. Okay, so in summary, Covovax is developed using a well-established technology that is the protein subunit vaccine using the spike protein, which is the one which attaches to the host. So it is just important that this antigen will be included in the vaccine, and that's what Novavax did. And aside from that, they have also added the adjuvant. And again, this is the first vaccine which demonstrated in clinical setting the cross protection against the UK and the South African variant strain. And as far as the safety profile is concerned, the vaccine is well tolerated with 0 to mild adverse reaction. And given that there's a substantial number of elderly population from the UK and the US study, so this can give us confidence to also provide this vaccine to the elderly population, those with comorbidities, and even those who are immunocompromised. So as mentioned earlier, this is a fully liquid formulation with a storage requirement of +2 to +8 degrees. So it comes in 5 ml dose vial, and you give it 2 doses, 21 to 28 days apart. So to end, I would say that, once Novavax will be provided an emergency use authorization in UK, in US, in Canada, and here in the Philippines. So this can be another, big help for us to control this pandemic. But we know that we have 3 vaccines with an EUA, and hopefully Novavax will be granted soon. But this vaccine will not be able to control COVID unless we have it in our arm, because vaccines will not save lives, but vaccination will save lives. So thank you so much for your attention.
And Dr. Manolet for your presentation. Indeed, vaccines won't save life, but vaccination will. Tama po yun. And we're quite nag-extend na tayo sa ating webinar, but it's been very informative for everyone. I hope you can still stay for the Q&As. I mean,
Sure.
we'll be asking most of your questions later in the Q&A. So we have our final speaker. And of course, last but not the least is the to talk about the private sector collaboration for COVID-19 vaccination perspectives from the Ayala Group. Let's all welcome the Strategy and External Affairs Head of AC Health, Dr. Rizzy Alejandro.
Hi, everyone. Good morning. Almost good afternoon already. I'm eating into your lunch hour. And I hate to be the person that stands in between you and your lunch, and actually in between you and the Q&A, because I know that the Q&A is usually the most anticipated portion of these types of webinars. Before I begin, just a big thank you to PACU for inviting AC Health. We're very happy to be here and share what we know about COVID-19 vaccines. Thank you to Sir Anthony and to Joyce as well for the invitation. I feel like this is a good way to sum up all the great presentations that have come before me. You'll see that we touch on a little bit of what Doc Bev mentioned earlier when she went over the government's view for vaccine administration. We'll also touch on a little bit of what Bill was talking about in his presentation on how the private sector came together with the DOH and the IATF to support COVID-19 vaccine administration. I feel like this is a little bit of a part 2 of what Bill was talking about earlier, because I'll be talking about more of the administration part and actually how we plan to roll this out for the Ayala Group. And then, of course, to our other speakers, we have Novavax as part of our pipeline as well for vaccines. And so it's a good way to tie everything together and to segue into our Q&A portion. So I'll make this fairly quick just because a lot of what I have in my slides have already been touched on by the previous speakers. Our goal here today is to give you an idea and a flavor of how we're planning to roll out vaccinations in the Ayala Group. Of course, there are many different efforts across the private sector in the LGU by the DOH on how to do COVID-19 vaccine administration. And this is just one view. A lot of things are still under development and still in flux. And so you might see some things that will change in the next few months, depending on our learnings as we start out this vaccination program. But we're happy to share with you what we know today. Just to start out, we always like to put everything in context and just to say that everything that we do is in support of the government. Bill already talked about how AC Health was one of the first players to be involved with the DOH and IATF as they were thinking about the vaccine plan. And we continue to be very strong supporters of the National Vaccine Deployment Program. You can see on your slide the different work streams that are involved with vaccine administration. As we all have realized, I'm sure through all the presentations, this is not an an easy task. It's also not something that we've done before in the country to this scale. And so it will really take different sectors working together to make this possible. We in AC Health and the Ayala Group do support across a varied set of work streams, whether that's from procurement, logistics, administration, even the communications part. And I think what we've learned is that this is really only most successful when everybody pitches in and does their part. This framework is maybe the one slide that you can take away from this whole presentation. It's how we're viewing COVID-19 vaccination. We call our program actually the COVID Shield program, and that very aptly because we know that vaccines give you that extra layer of protection or that shield against COVID-19. And we like to frame it in 5 S's. And for everybody listening in this call, I think the 5S framework is also a good way for you to think about your own vaccination programs. I know there are a lot of school administrators on the call, and you're thinking about, how do I roll this out in my own school, university? And I would encourage everyone, you can borrow this framework and think about it along these lines, and make sure you're covering all of the 5 S's. And those 5 S's for us are first, supply. Of course, this is just about getting those vaccines, access to those vaccines, and making sure that we have those doses in the country. And the DOH has been, and the IATF has been doing such a good job at this. One of the key takeaways from our previous speakers was that we do have enough supply of the vaccines, and that's great news for all of us. But of course, as was emphasized, we need to think about administration. And that moves on to the second S, which is where you scheduling. And this is where you factor in master listing, making sure that you schedule people to come in for their doses, any pre-screening that you could do ahead of time to make things more efficient. That's part of scheduling. The third S is shots. This is the actual vaccine administration. And you'll see later that, as Doc Bev mentioned, the priority right now is to set up DOH-approved vaccination sites. And these vaccination sites, think of them as super sites. So rather than setting up small sites here and there, we want to be able to set up super sites where we can vaccinate as many people as we can and as efficiently as we can. The fourth S is surveillance. So it doesn't end when you get your shot. It was mentioned earlier that the whole observation period is up to a year after you get vaccinated. And that's why surveillance is so important. We want to be able to see how effective these vaccines are, who's been administered the vaccines, are there any side effects that we need to be tracking or worry about? So that's why surveillance is such a strong component also of this framework. Finally, and underlying all of this is science, the fifth S. And science, I think, is so important. I was so happy to see Dr. Burimal give an overview of the science behind the Novavax vaccine. And really underlying all of the different S's, you should always have a strong scientific background behind it. Look to clinical data, look to the literature that's available to inform all of the other different S's. So I think the academics always appreciate the science behind things, and it's good to be in a room of people who appreciate the research and the data behind all of the many things that we do. And so just to emphasize that as you think about your own programs, never to forget the importance of that research, education, and communications component. What I'd like to do is to take you briefly through each of these S's. What does this mean for the Ayala Group, how we're thinking about it, and how we'd like to roll it out. And hopefully you can learn something or pick up some things that you'd like to do for yourself also. The first one is on supply. We've taken a portfolio approach to vaccines. So very similar to the way the government has done it. The priority was to be able to secure a supply of vaccines. And the best way to do that amidst a global shortage is really to think of a portfolio so that you have different sources of vaccines coming to you, and should anything happen to one of those vaccine sources, you still have other sources that you can go to. For us at the moment, we have a portfolio that includes AstraZeneca and Moderna, and we will potentially also add on maybe Novavax, Pfizer, or J&J in the future. You can see in the bottom that we know vaccine logistics is quite complex. I think we saw from the previous presenters already how logistics plays such a strong role in what we're doing here. And just to say that we are working closely with the government, and this is not to be done in isolation. The next S on scheduling, on the Ayala side, what we'll be doing is using our app called Health Now. For those of you who have smartphones and would like to try this out, you can actually download it already. Just go to your App Store or your Google Play Store, and then you can download Health Now. You can consult with a doctor there, get your medicines delivered. And the plan is for us to use this platform so that anyone who needs to get vaccinated will just register through the app. You get your notifications pushed through the app. So for those of you who like to use Shopee and Lazada, you know how Shopee and Lazada sends you mga notifications, ganyan. Similarly, we intend to use also technology to be able to remind people, come for your first dose, or come back for your second dose. And then in the actual vaccination site, we will use it also for check-in, for monitoring you while you're updating, of course, your records so that you get your records on your phone. And finally, after vaccination, we're all looking forward to having that passport or certification that we've been vaccinated. We plan to do all of that through the Health Now app as well. And I think it's been highlighted that technology will play an important role in vaccine administration. The next S is shots. And here, I think the most important thing is that we've been working closely with the DOH. That's why you see this floor plan. You might remember it from other slides that you saw earlier, because we are trying to align ourselves with the DOH standards and protocols. And within the Ayala Group, our goal is to be able to administer 1 million doses by the end of the year. That's a combination of Ayala Group doses as well as some doses from our external partners and clients. Although, to be honest, as some of the earlier speakers pointed out, the big issue here is administration. And so we do have a limited capacity. Our plan is to open 20 sites nationwide. These sites will be capable of vaccinating anywhere from 300 to 600 patients per day. And we'll have several vaccination teams there. Earlier, you saw it 6 to 8 people per team. We're planning to have about 3 to 4 teams per site. And taken all together, that gives us a capacity of about 6,000 vaccine administrations per day. And so we're very excited to support the overall goal of the government to get to that herd immunity level that we were talking about. Surveillance is the next S, and here just to say that that includes patient records, adverse events monitoring, vaccination passports, and of course the data and the analytics. We all want to know ilan na bang nabakunahan, ilan ang may side effects, ilan pa yung kailangan nating ma-vaccinate, and so we hopefully will be able to do that through our health technology or that Health Now platform. And what's important here also is it's all integrated with the Department of Health, with the LGU. So all of the data that gets generated also gets reported up to the Department of Health and to the IATF so that everything is unified and everything is in line with what the government is doing. And then finally, the fifth S, which is science, just to highlight some of the data that was brought up earlier around vaccine hesitancy and the importance of communications. In the Ayala Group, we also in the early days saw some vaccine hesitancy. I think people are apprehensive about knowing the side effects of the vaccines, knowing how effective these vaccines will be. And the approach that we took is to do webinars like these and town halls, and met with the employees, allowed them to ask questions, allowed them to raise what are their concerns, what myths would they like to clarify. And that's really helped us to engage our employee base and at the same time also improve vaccine acceptance. And right now, I'm proud to say we have about 60,000 employees in the Ayala Group, and we have an 80% willingness to vaccinate, which is great. We're hoping to increase that even further. That's why our communications and our advocacy campaigns continue. For those of you who need help with extra resources, the DOH has great resources already that are available. The AC Health website will also have resources for you available in terms of FAQs. We're happy if you share it. We will be doing a campaign as well on our Facebook page, and you can share those to your groups. It's really important that we all work hand in hand for the education. And I think that's something that you should think about also as administrators and as school heads within your own teachers or your own staff. How many of them want to be vaccinated, and what can we do to improve that? I understand within this group at the start, we had such a high vaccine willingness. That's great to hear. I can only hope that goes for the rest of your organization as well, because that's really good news for all of us as a country. I'm very proud and happy to say that we've started vaccination in our QualiMed hospitals. The first one was in QualiMed Santa Rosa just this Sunday, where we administered AstraZeneca and Sinovac vaccines. we were able to vaccinate 300 of our healthcare workers. And what excites me the most is that we had such a low number. Well, actually, nobody said no to the vaccine, which is great. Everybody just, regardless of the brand, was able to get vaccinated, and will continue to roll out more vaccines as we get them. And we're very thankful to the DOH and the IATF to be given this opportunity. It's great to see that after months and months of thinking about vaccinations, of working on this behind the scenes, that our vaccine program for the country has actually kicked off. And I just wanted to highlight that this is an achievement we should all be proud of, given the global vaccine situation, that there's really a shortage of vaccines. So it's great that we sort of see the light at the end of what has been a really long and tortuous and difficult tunnel for all of us. I'll end with this slide, which I think is a great summary of everything that's been discussed this morning. And it's what we think of as key imperatives. So things that need to be done as we roll out our COVID-19 vaccination program. And we've summarized it on just 5 points. One is ensuring that we have the adequate supply of vaccines. We have those vaccines coming in. It's making sure also that we support the logistics and we're able to integrate across the different institutions, the different stakeholders that are involved with securing that vaccine supply. But beyond the supply, the second thing that needs to be done is to operationalize large-scale administration. And this is really challenging. We have issues in terms of facilities, in terms of manpower, our healthcare professionals. Do we have enough healthcare professionals to do this? And it's important that we work all together to build these large-scale administration sites. Second is where we can leverage the use of data and analytics so that we're not doing things manually and that we can hopefully streamline things and make it more efficient. Fourth, and very important, is that communications campaign, building vaccine trust and confidence. And all of us have a part to play in this. It's making sure that you pass on the correct information, where you can have these conversations with people, because I find that it's in one-on-one conversations that people really open up about their fears, and that these fears and concerns can be most effectively addressed. And then finally, just to underscore that we in the private sector are big supporters of what the government has initiated. We are 100% aligned that this is something that we should all work on together. Lahat po ng dinesign namin dito, hindi po namin ginawa independently. It's all in support of the government. And moving forward, we really need everybody to be working together towards getting that goal of herd immunity, and hopefully helping our country recover. And one day we look forward to reopening schools. I'm sure you're all looking forward to that as vaccine administrators. We look forward to seeing the economy recover. And all of that can only happen if we all do our part and get vaccinated. So thank you so much for everyone. I'm happy to take your questions later on. And thanks once again to PACU for organizing this webinar.
Thank you to our last speaker, Doc Rizzi. We are very happy to note that the private sector and the AC Health is taking a proactive stance in the COVID vaccination drive. So again, for those who are tuning in via Facebook, you can ask your questions through our comment section. And I'd like to call back on screen our resource speakers. And at this point, I would like to turn you over to our moderator for the open forum. He's a good friend of mine, a former assistant secretary at the Department of Education, and he played a big role, as you know, in the K-12 program. And right now, he heads as the executive director of the Philippine Business for Social Progress. Let's all welcome Mr. Elvin Ivan Uy.
Thank you, Joyce. Magandang hapon. Because of that introduction, I will give you 2 doses of vaccine, care of an unspecified brand. But joking aside, it's nice to see all of you again for PAC, for PACU, for Cocopea. It's nice to be amongst family and familiar faces and familiar names. Thank you most of all to those who have stayed on since 9:45 a.m. until now. You won't get free vaccines for listening for more than 3 hours, but the information and the knowledge that you gain from this session will hopefully give you a sense of security, number one, and then number two, be an advocate for your family, your school, your community, so that we can together achieve herd immunity for all Filipinos. Now, we've been monitoring the questions on Facebook. Thank you to everyone who have been very active with your clarifications or requests for information. What we'll try to do so that we can organize the discussion, we'll ask all the medical questions first to our 2 medical doctors here, si Doc Nancy at si Doc Racy. Yun munang mga tanong tungkol sa safe ba yung bakuna, ano yung safe na bakuna para sa akin o sa kapamilya ko, etc. etc. Yung pangalawa naman, pag-uusapan natin ano yung maaring pagplano na gawin ng mga pribadong eskwelahan na tulad ninyo. So, given all of this information from Doc Bev earlier and then from the private sector and the development sector, ano ba yung maaari namin gawin para sa eskwelahan ko, para sa mga kapwa ko guro, kapwa ko punong guro, at siguro pati sa mga mag-aaral ko. Yung pangatlo, at kung may oras pa tayo, we'll also have a quick discussion on what can this sector do, the private school sector, what can you do to support the national deployment and vaccination plan, and how can we together defeat COVID-19 and the SARS-CoV-2 virus. Okay? So if I know it's 12:21, we'll try to do a hard stop before 1 o'clock. For Doc Nancy and Doc Rizzy, any of you can take these medical questions. One of the frequent questions from Facebook is, can you guys comment about the applicability of certain vaccines to people with pre-existing conditions? When I say pre-existing conditions, medyo wide range to. May tanong tungkol sa high blood, may tungkol sa may cancer, or meron ding tungkol sa mga senior citizens. Can you give us some guidance, or the audience some guidance on what would be safest for them given the vaccines that are coming in, the 7 brands that are part of government's portfolio, vis-a-vis maybe individual conditions or risk factors for our audience and their family members?
Doc Rizzy, you wanna take the question?
Okay, sure, Doc Nancy. I think in summary, what we always tell people, Elvin, is these vaccines actually have been given to a wide range of different types of populations. And I would encourage everyone that don't discount yourself from getting vaccinated just because you have a previous condition. So the number one question we usually get is, may high blood ako or may diabetes ako, can I get vaccinated? And people are worried that just because they have these conditions, they cannot get vaccinated. And the truth is, you can get vaccinated if you have comorbidities. There are very specific conditions that the DOH says you need to get clearance. So ano po yung mga specific conditions na to? One, if you're actively undergoing cancer treatment, if you're undergoing any form of steroid treatment, if you are, for example, have any if you are post-transplant, or are taking any medications that alter your immune system. So these people will need to get clearance before they can get vaccinated. There's also a group where you might need to just figure out what the right timing is. So anong group po ito? These are the pregnant women. So you saw earlier na if you're in your first trimester, you cannot get vaccinated yet. You have to wait until your second or your third trimester. You have had COVID before, you have to wait 90 days before you get vaccinated. So timing, it's not that you cannot take it, it's just the best time for you to take it. And then finally, I think what people are worried about is itong issue of is there a specific brand that works better for a specific group? Right now, there's no recommendation for a specific brand for a specific group, right? You really have to just rely on the DOH and the policies and protocols that are issued. For example, in terms of yung age group, we know that Sinovac is for those 18 to 59, and then Astra is for those that are older, right? So we follow those guidelines. I think people are scared that they might be forced into taking a vaccine that's not indicated for them. I think wag po tayong matakot doon. I'm sure when you go to these vaccination sites, they will take into consideration your medical history. There is an assessment that happens there. So hindi naman po kayo mababakunahan with something that is not indicated for you. And so I think it's important to try to put that fear a little bit aside. I understand it's a very legitimate fear, but it's something that we all try to be careful with. That's why the DOH is making an effort to set up these vaccination sites. And last point, Evan, I'm sorry, that was a very long answer because your question is very actually complex, maraming layers. My last point is just that there is only one absolute contraindication for you not to get a vaccine. And that is if you've been vaccinated previously with that vaccine and you developed an allergic reaction to it, you cannot be vaccinated with that vaccine, or if you are allergic to any of the components of the vaccine. And then they list specific components depending on the vaccine. And you will be asked that po when you come into the vaccination sites that will be screened also. And so my message to people is always don't discount yourself. Talk to your doctor to make sure na okay ka lang ma-vaccinate. But for the most part, we see that this vaccine is well tolerated among different populations.
Salamat, Doc Rizzy. Doc Nancy, if you would like to add.
Yeah, sure, Elvin. So just to add to what Dr. Rizzy mentioned, yung from the pre-enlistment pa lang, yung kino-communicate natin is answer the questions as truthful as possible. Kasi doon, no, you'll find out the age, your work, no, because of the risk of exposure, then your current medical conditions, the medications that you're taking. So from that part pa lang, no, sa pre-enlistment, you will be given an advice whether if you need to get a medical clearance or not. So the COM is answer the questions as truthful as possible, not undermining na para kasi I don't want to get the vaccine, so I'll just say I have these conditions. Or you'll hide some of your conditions kasi you want to get the vaccine. Hindi po. So lahat ng dapat i-declare po natin doon to ensure that everyone will be safe, no, once you get the vaccine. And yun sabi ni Dr. Alejandro kanina, meron namang mga gagawin dun sa vaccination site to ensure that everyone will be safe, no. And even moving to the post-vaccination surveillance, kailangan pong mag-cooperate din tayo dyan para malaman talaga natin. No? Kasi remember, yung mga data na sinasabi natin ngayon, in ideal setting, in a clinical trial setting, no, na may doktor na mag-monitor sa'yo, no? Even mag-follow up sa'yo, pero pag evidence na yan, which we need all this data, kailangan po talaga ng cooperation natin lahat. No? So fill up the form and then go to the site, sagutin yung mga tinatanong sa inyo, and then even the post-vaccination surveillance, mag-cooperate po tayong lahat.
Right. Salamat, Doc Nancy. I have a two-part follow-up question in the interest of time. Yung una, nabanggit to ni Doc Rizzy, is there any situation where talagang hindi safe magpabakuna? Nabanggit ni Doc Rizzy kanina, if you had adverse event or reaction to your first dose, that probably should give you pause for a second dose or of any brand. Right. My other question, this has also been asked in different fora and discussions. Can you mix different brands? For example, yung first dose mo is brand A, your second dose is another brand. Is that possible or is that even recommended or safe?
No, because we don't have data on that, Elvin, no? Because the data that are provided by the company is based on giving the 2 doses, no, in the right amount and the right interval. So mixing two vaccine platforms or two vaccine brands, we don't have data yet on that because I know you know that the currently available vaccines like hepatitis B, no, you can interchange. Kasi hepatitis B is a it has been available for a long time. We have years and years of experience, so we can say that you can actually interchange. But for this COVID vaccine, we don't have data. But let's say yun nga no, yung situation na nagkaroon ng allergic reaction from the first dose, so the person cannot receive already the same brand. So in that situation, bibigyan siya ng another brand of vaccine. Take note we have to read talaga the product information. So for the Astra vaccine, it also contains polysorbate, hindi lang yung Pfizer vaccine. So we have to ask about history of allergies aside from polysorbate, Astra contains other excipients. Kasi yung allergy hindi naman siya necessarily dun sa antigen or dun sa immunogen. It's caused by the excipient or the other components of the product. Like it contains ethanol, it contains your polysorbate. So meron naman yan, no? Babasahin naman, binabasa naman yan ng mga vaccinators. So kaya itatanong din niya lahat. Pero sa atin, this information are out there in the FDA website. No? There is an information for the healthcare worker and there's also information for lay people who will plan to receive the vaccine. So kailangan po informed tayo talaga sa lahat ng gagawin natin. Thank you, Elvin.
Right. Thank you, Dr. Nancy. Rizzy, yung follow-up lang yung aside from potential adverse reaction from a first dose, is there any other factor that should say, hindi ako magpapabakuna? Hindi yan safe sa akin or hindi ako ligtas para magpabakuna?
No, actually, those are the absolute contraindications. That's what, yun yung medical term that we use, no, absolute contraindications, meaning hindi talaga pwede, right? And that's what Dr. Nancy mentioned earlier, na you might be allergic to a specific component of the vaccine. And then if you had a previous allergic reaction actually, so hindi siya side effect because there are some side effects that are common and expected. So for example, pain on the vaccination site is very common. So about 70% of patients who get vaccinated, magko-complain sila na medyo masakit yung area na nabakunahan. And I'm sure sa mga nabakunahan na with the flu vaccine or any other vaccine, baka na-experience nyo rin yun, diba? And that is a side effect that is mild. It resolves in 1 to 2 days, nawawala din yung pain in that area. Fever or chills, these are also very common. And these mild side effects will not stop you from taking the second dose. So it's really just very severe allergic reactions, what we call yung mga anaphylactic, no? So your throat closes, you cannot breathe, or talagang nabaga yung face nyo and yung neck nyo. Those types of reactions are the ones that we're worried about.
Right. Thank you, Dr. Rizzy. Now, I'll move on to the second set of questions. But with apologies to our audience, marami tayong clarification kasi tungkol sa timing nung rollout ng vaccination. And I think those are questions that Doc Bev could have covered if you were here. Si Bill Luz might also be able to cover them if he comes back to the panel. But otherwise, I won't compel this panel to answer those questions. So what I'll ask instead are questions about how private schools may prepare themselves for vaccination. So I think two set to, diba? For the private school. May scenario na maghihintay ka lang na masama ka na dun sa prioritization at yung schedule ng site on an individual level. Meron ding side na yung private school mismo naging bahagi ng tripartite ng kung ano mang vaccine brand at ano yung kailangan niyang gawing steps para mapaghandaan yung pagbabakuna ng kanyang staff na in-house niyang inorganize or ima-manage. So for maybe as a general, this is not a specific question yet, but maybe this panel can answer. For private schools that do not have the resources or the means to procure their own vaccines and manage their own vaccinations for COVID-19. What would you recommend they do? Meaning, how can they ensure that their staff are well informed about the vaccine, number one, and then number two, will be given the vaccines once the prioritization list reaches them.
I can start, Alvin, and then I'll pass it on to Manolet and to Doc Nancy. So I think what we've seen so far, because we work closely with a lot of other private sector companies, and the private sector companies have taken several types of approaches. One is that there are private sector companies who have purchased their own vaccines. And I use the term purchase very loosely because these vaccines are actually not for sale. It's a special agreement that you have with the government and manufacturers like Unilab working together to be able to give access to these vaccines. So some private sector companies have gotten these doses and have allocated them for their employees and for some of their employees' dependents. So that's one route. If you're part of a private sector group that has the capacity and the resources to do that, that's one good way to get access to the vaccines. Of course, we understand that not everybody has the access to those vaccines or the resources to do it, especially for a lot of our private schools that have been hit by this pandemic. And so the second route that we see people taking is to work closely with the LGU and with the DOH. As was reassured to us earlier, we will have enough supply of vaccines in the country, and it's just a matter of coordination. I know that teachers are in fact included as priority groups in the DOH framework. And so as private schools, I think what you can do is make sure that you're part of that master listing exercise. So may mga LGU na po na nagsimula ng master listing. They've already started asking people to sign up for vaccination. So make sure that you sign up for those DOH or LGU programs so that when the time that the vaccine gets here, you're already enlisted and you can be guaranteed a slot there. I think the important thing is for all of us to have a little bit of patience. I know excited po tayo lahat mabakunahan. And I think it's just a matter of time before we all get vaccinated. We're waiting for our supplies, and our friends at the DOH, IATF manufacturers like Unilab, Pfizer, Moderna working hard, AstraZeneca working hard to try to get those vaccines here. So we just have to be a little patient po. And I think the best thing we can do is to support the DOH and the LGUs.
Thank you, Doc Rizzi. Manolet, please chime in.
Thanks, Elvin. So I would agree with Dr. Rizzi on that. First of all, we have the approach that we're all working together. And so how can we actually contribute and participate? I guess to that question, there are two sides to that. There's the supply side and there's the administration side. And then for each one of those, there's the government supply and there's the private supply, and then there's the admin for those two types of supplies. So depending on where the school might fit in, I think will also depend what approach they might be able to take. So if they're able to access the government supply, the private supply, for example, whether it's AstraZeneca, Moderna, or through Novavax, so they can secure the supply for their employees and for their dependents on the one hand. And then on the other hand, they also work with administration provider, can it be hospitals or a group like Ayala Health or other administration providers. I think what was mentioned by Dr. Bev earlier, and I don't want to misspeak, but I understand that there are going to be sites where the country will have to look into in terms of increasing the capacity of the administration, right? So if schools, for example, are tapped as potential areas of administration, right? And I think there's a process which Dr. Bev had mentioned in terms of getting accredited and being potential sites. And I think they have to work through the LGU on that to ensure that they have the right facilities, the right people, the right backup. If you need if you need an ambulance there, for example, for potential adverse events, for example. So I guess it would depend on where the school might fit in. If they're not able to access the private supply, as was mentioned, there is government supply there, which is sufficient for everybody. And so I think it just depends on where they fit in. I would echo what you mentioned about communications, especially for the school leadership and the administration, where they can access a lot of information which is has been developed and being developed. The DOH, as was mentioned, has a lot of resources which are freely available on their website. Unilab also is producing materials along those lines that we plan to share with our partners, that they can communicate that to their employees and the dependents. And so I think the communication part, I think people have a responsibility if they're in leadership to, I guess, send that message out and to continue that, especially as the vaccines will be really starting to come and made available in the second half of the year. Thank you.
Thank you, Manolet. Doc Nancy, would you like to add anything?
Yeah, Elvin, I from my end, may question ako to Paco. Kasi Unilab is also doing education programs with the grade school and high school, the Akap Guro project. This involves private and public elementary and high school. So for Paco, kasi they will have a role in the vaccination program, either as to provide this education to the vaccinees. For Paco, I'm not sure if they have considered that, partnering with LGUs on how they can also be part of the vaccination program. So
that's a very good question.
It's
I don't know
really from the LGU.
Right. I don't know if anyone from Paco would like to answer, or I could give you a few minutes to think of a response, and then we can ask a few other questions first. Anthony, would you like to do it now? Hey, Anthony, naka-mute ka lang if you're answering.
Well,
we'll just put him on frame also for the audience benefit. Right?
Yes, we have been in constant coordination with our LGUs, but that is more for in helping out with a resumption of the limited face-to-face, and also providing schools as possible vaccination sites. So that coordination has already commenced. Now, as to the specifics, Dr. Nancy, of the program you were mentioning, maybe we could have a copy, then we could further pursue that program, since most schools are already also coordinating with the LGUs on the possible vaccination sites. But if there's another program that we could participate, we could explore also that opportunity and perform the role of the schools in the vaccination process.
Yes, sir. Actually, that program, so we bring in DOH, DepEd, MMDA. So parang it's a venue where these agencies also talk with the DepEd and with the teachers, no? So parang sharing what else can we do to help in the rollout of vaccination program. Para the teachers can also be confident, as a part of this vaccination rollout, and also be confident to also receive the vaccine. So parang two-way yun, sir, yung webinars na to for teachers.
We'd be very much interested, because one of our main goals, that's why we're holding these webinars such as this, is to encourage vaccination. So we're definitely interested, and maybe we could reach your office on how we could...
Hala, sinalang talaga. Pero sige sir, we really want to help, to improve yung vaccination uptake. And kasi madami talaga, di ba sir? Ano ba? Especially for the teachers, ano bang magiging role ko dyan? Or unang-una nga yung tanong, should I get the vaccine? Diba,
yes. I think it would help address most of their trepidations or their fears about vaccination. So I think that would be good.
Right. Thank you, Anthony. Thank you, Doc Doc Nancy. Maybe straying a bit from my role as moderator. Tama yun ah. From our experience also as a nonprofit, the more you're active in these discussions, from planning to helping in any part of the rollout, the more access to critical information you also get. Para siyang classroom actually. Kung active ka sa klase mo, mas natututo ka. Pag medyo nasa row 4 ka, nasa dulo, hindi umaabot sa iyo yung lesson. So ganun din yung itong kampanya sa bakuna. So yes, I think I know PACU, COCOPEA, PAC, these are very large networks of private schools, and each school has its own unique circumstances or context. But there's a lot of opportunity to engage, especially at the local level. Going back to the Q&A, ito common question to. I don't know if it's fair to ask any of our panelists from the private sector. Can you comment on the timing of the arrival of the vaccines? Meaning, yan ang common concern ng lahat eh. Sa ngayon, we have about a little less than 1.1 million doses from two brands. And then, alam natin na ang plano ng gobyerno, national government, at least 148 million doses, at least, di ba? To cover more than 70 million Filipinos by this year and maybe until next year, given the timing of the arrivals. Pero meron ba kayong masabi na itong buwan na to, sa March, ilan ba talaga ang darating? Sa Q2, April to June, sa Q3, sa Q4? So I think for Unilab, I'll ask specifically for Covovax. For Dr. Riz, this is unfair to you, but maybe if you could comment on everyone else's timing, if that's something that we can answer.
Yeah.
Sige, si Manolet muna for Covovax.
Sige, I guess in general, I mean, most of the vaccines will really arrive in the third and the fourth quarter. So for Novavax in particular, we're looking at the potential EUA or emergency use authorization, as early as end of May. Our assumption of the Covovax availability is July, as was mentioned earlier, in terms of our base case, where most of it will start to come really in the big volumes in the third quarter. However, there is a chance that we actually are able to get it earlier, which would be by end of May. And that's of course subject to whatever the regulatory and the supply situation is at that time. Now, in terms of the volumes, for Covovax, it's going to be over 30 million that will come for this year, right? And so in the second half, and so I think you can probably assume between 5 to 7 million every month from Covovax point of view. Starting July, if we are blessed, then maybe that comes as early as May.
Right. Thank you, Manolet. Doc Rizzi?
Yeah, sure. I'll comment, Alvin. And this is our dream is we will start vaccinations in June. And so we're expecting that the first few batches of at least what the Ayala Group ordered through these tripartite agreements with the government, AstraZeneca and Moderna, we're hoping the first batch of that will come in June. And then from then on, the vaccines will be coming in on a rolling basis. So we don't expect everybody to be vaccinated in June because the vaccine doses will not arrive all at the same time. And our thinking is that this will continue up to December, maybe even up to early 2022. Internally, our goal is to be able to administer 1 million doses throughout our COVID Shield vaccination network.
Right. Thank you, Doc Rizzi. Anthony, would you like to chime in now? Or
yes, I just like also to add that some of our schools have already participated in the vaccination program with the healthcare workers of our faculty, and in fact, some of our concerns is if we have enough freezers, especially those schools in the province who would need to have freezers to keep the vaccines given the period. And some already of our schools have partnered or talked with the LGUs on the fantastic idea of already start listing who should be vaccinated to be part of the master list. So they already also have begun those efforts. So, Dr., I think we could even further, while it is already started, we can even uh, proceed more with how to be more involved. Again, it's the race of vaccination versus mutation.
Thank you, Anthony. Now, there was a question from the audience, or several questions from the audience. They might have missed that part of your presentation, Mananel. Can you again remind our audience how, for those who are interested to secure their Covovax doses, how can they engage Unilab?
Yes, yes. So if we weren't able to catch it earlier, so we have a program where we partner with companies um, for to get the vaccines for their employees and for their dependents. And so we're able to sign a term sheet together with our partner company. And what that shows is, one is there's a price of 1,000 pesos per dose, maximum, which might come down times 2 doses. And we would enter into that agreement. And then as we get closer to the approvals and we get more information, we can convert that into a purchase agreement. And so for any company or school that is interested in that, they can contact our consumer info email, which is info at unilab.com.ph. So maybe you could share that with the audience on the chat box. But and then we can respond to you and give you more information if the school is interested to get for their employees and for their dependents.
Right. Thank you, Manolet. Again, that's info@unilab.com.ph. Info, I-N-F-O.
I-N-F-O, correct. Yes.
At unilab.com.ph if you have any queries or specific orders, I should say, about for Covovax. Now, my final question to our three panelists, to Manolet, Doc Nancy, Doc Rizzy. Do you have a final tips or message to private schools, to PACU, to COCOPEA, to PAC, on how they might help the government reach its target of herd immunity for our population? So in a nutshell, how can they help with the national deployment and vaccination plan? So just highlight key messages that you've also already mentioned during your respective sessions earlier. Let's go first with Doc Nancy.
Thanks, Elvin. Siguro in general, so let's get ourselves vaccinated. The sooner we get protected, the better. And then continue also monitoring the developments, the data, because remember, this data that were submitted to the regulatory, they're all interim data. So continue monitoring any developments from reputable sites on the further data that will be released by all these companies in order to really ensure that we will all be safe, that the vaccine is effective, and we can be confident and, reaching the point that we will all be back to our usual routine daily activities. And sa ngayon po, ingat po tayong lahat. Siguro yan yung aking message, Elvin. Thank you.
Thank you, Doc Nancy. Rizzy?
Sure. Thank you, Elvin. First, I think a big thank you to PACU and to everybody on this call. I know it has not been easy as well for our schools. I don't know how you all do Zoom schools or schools from home. I can only imagine. Imagine ko po nung estudyante ako kung kaya ko pong umupo in front of my screen, and for all of you as teachers and educators to do that also and still be able to engage your students. Hats off to all of you also for all of your hard work and dedication in operating during such a difficult time. I think for your part, you are our educators, and if there's anybody who can help us with vaccine education, it's you, all of you who are the experts in education. And so any way that you can help us to promote vaccination through your own networks. I know you have very strong teacher councils, very strong parent councils, and any way that we can involve them and spread the word. As Doc Nancy said, the best vaccine is the one in your arm. And so we really have to educate as many people as we can. And we'll look to you, our educators, to help us to do that. If you can figure out how to operate your schools during such a difficult time, I'm 100% confident that you will help us also to educate even those who have said no to being vaccinated. And hopefully we'll be able to convert those people and get more people vaccinated.
Thank you, Doc Rizzy. Manolet?
Yeah, I mean, maybe just two main messages. I think that the first one is that to follow the science, you know, and to believe in the science. There's a lot of information out there, and hopefully this forum has emphasized that and also shared that, you know, that there's a lot of effort which goes into the clinical trials and the data, and that's all widely available. And to use that science and to communicate that, especially if you're in a position of influence, such as which teachers are, you know, and educators are in, where they're able to now share that and communicate that in a manner which is understood and by the general population or those who they're able to in their spheres of influence, right? And then the second one is really just generally to work together. You know, I think all the sectors, government and private and different industries and different professions are able to somehow use their capability sets, you know, and to bring that to bear as we face this challenge together. And you know, schools have their own unique skill sets, which has been mentioned, and the pharmaceutical companies have that, logistics companies have that, and I think now it's just the time to all come together and to put this to an end.
Thank you, Manolet. Now, Bill has joined our webinar again. I'll ask Bill for his final message. But
Sure.
also, Bill, in case the audience has questions for you, because next to Secretary Galvez, Secretary Dizon, you probably know a lot more than most of us in this room. If they have specific questions, how can they reach you also?
Yeah, sure. Well, specific questions, you can email me at luz.gm@ayala.com. And I will try to answer as fast as I physically can. Well, my last message, first of all, thank you to PACU for the invitation. These fora are really important. I've attended a few, I've also organized a few, but there's one thing I find as an outcome from all these fora is that if we take a survey before the forum and after the forum, we always notice the vaccine hesitancy goes down and the vaccine enthusiasm goes up. There are always more people at the end of the forum willing to take vaccines because they've learned more about it, and I think that's important for all of us to learn from each other. Number two, as I wanted to stress earlier, we have enough supply. Our challenge is administration. I think we need to put our heads to try to address this challenge, and I think the private sector is well positioned to help the government because we have a lot of private hospitals and clinics who can help. And the third has to do with just getting vaccinated in general, which is we are all protected if we are all vaccinated. If we have a large number of people who don't want to be vaccinated, even the anti-vaxxers are going to be vulnerable, just like the rest of us, right? So this is the type of thing where we're all in the same boat, and we either all get vaccinated, and if a large number of people don't get vaccinated, they're making themselves and the people who they interact with vulnerable. So I think it's in our best interest to act together and all get vaccinated. So thank you very much for the opportunity to PACU. Thank you.
Thank you, Bill. That's this is a public webinar, but just to ibubulong ko na lang, lose.gm at ayala.com. Don't pass it
Oh
on,
no,
not to the spammers. Yes.
I might regret that now.
Yes. We might block off that portion of the audio para hindi ka naman ma-spam masyado, Bill. But thank you again to all of our panelists for their insights and their sharing this morning until early afternoon. Let me just wrap it up by saying that from the session with Doc Bev to our sessions with Unilab, with PDRF, with AC Health, we've seen what the government intends to do and how the private sector and the non-government sectors are trying to work together with government so that we address this COVID-19 pandemic. Now, the vaccines is not a silver bullet that will not solve all of our problems, but it will be a significant boost to us in trying to defeat this COVID-19. Let me quickly share just a few things for everyone to take note of. I hope you can see my slide about the National Deployment and Vaccination Plan. So if you want a copy of the plan, please do so. It's a 129-page document, 119 if you take out the cover pages and the tables of content. You can read about it. You guys are academic institutions. Please read about it. It's the best way to combat ignorance or disinformation. Yun yung mas delikado, disinformation. Ay magbasa tayo ng totoong impormasyon, totoong knowledge, or totoong signal. So read the National Deployment and Vaccination Plan for COVID-19 vaccines. Follow and like DOH Philippines. If you're on Viber, also subscribe to the DOH Philippines Viber group to get up-to-date information from the authority about this. And then what I will also summarize is that this is, in fact, the challenge for all Filipinos. Bill put it well in one of his slides. The government targets to reach about 76, 77 million adult Filipinos in the next, actually dapat 2021, but realistically, maybe until end of 2022. So 70% of our population, practically all adult Filipinos, anyone ages 18 and up, they are, ang target natin, lahat sa kanila, mabakunahan. Now, given this audience, when we started the session, 86% of you are confident about the vaccine or were likely to accept vaccines. But based on the question, it seems the challenge now is not vaccine hesitancy, but implementation hesitancy, right? There's a lot of questions about can government pull this off? National, local governments? Can we pull it off as private or non-profit institutions? And it's a question that cannot be answered just by thinking. It's a question that will be answered by doing. And if you are in the position of doing, this is how you can help. If you are, as what Doc Nancy Manolet have also mentioned, if you are in a position to engage your local governments, ito yung kailangan ng mga lokal na pamahalaan. Yung 129-page na NDVP, you can boil it down to these two major components in terms of how the plan is executed as actual vaccinations. Hindi bakuna, pero pagpapabakuna. Sabi nga ni Doc Nancy. Ang una, yung tinatawag nating 3M, Master Listing, Microplanning, Mapping. So, nasaan at sino-sino tong lagpas 70 million na Pilipino. Tapos yung pagpaplano sa lokal na level. Saan ang vaccination sites, sino ang bakunador, sino ang magbabahay-bahay para magkumbinsi ng mga tao na magpabakuna. At yun, yung buong proseso na yun, di ba? Tapos gagawin mo siya a second time for a 2-dose vaccine. So yan yung, kung nasa posisyon kayo na pwede kayong tumulong sa gobyerno, give your sites, your physical sites for vaccination, lend your manpower to help, all of those, or even lend your expertise in actual planning and execution. Those will be a very big help. The other big area, the bottom half of this slide, talks about risk communication and community engagement. Ito yung how do we combat vaccine hesitancy within our population. We know that less than half of our fellow adult Filipinos would like or are confident about the vaccines for COVID-19. How do we change that? And we're not talking about national data. How do we do it on a per barangay, per city, and per municipal level? Doon, I think, doon tayo pinaka makakatulong or doon kayo pinaka makakatulong bilang private schools at ang pribadong sector. So let me wrap it up and say, with this audience, it seems it's not about vaccine hesitancy, but implementation hesitancy. And because I came from DepEd, and because we had this experience 10 years ago with K-12, that was the same thing. It was a hesitancy first on the idea of K-12, and then eventually on the implementation of K-12, which took 87 years to be passed as a law. We don't have 87 years to address this pandemic. The good news for all of us, because of science, because of government, and because of the private sector, vaccines are here much, much sooner than what we anticipated at the start of the pandemic. This is a triumph of those three things: science, government, and private sector working in concert to make sure we have a scientific solution at hand this soon, less than a year into a global pandemic, of which none of our generation have experienced that prior. But the vaccines alone are not a solution. Yung bakuna dapat ma-deliver sa bawat adult sa Pilipinas at sa buong mundo. That's how we defeat this COVID-19. So let's continue that dialogue, but let's also continue the doing, or let's start the doing. The thinking and the issues and the problems will not stop, but day by day, week by week, month by month, I think we can get closer to a real solution to this pandemic with science, with government, and especially with and amongst us in the private sector. Yun lamang po, magandang araw sa inyong lahat. Thank you to the panel. I'll turn it over again to Joyce.
Our panel, to give our closing remarks for today, let's all welcome the first Vice President of PACU and the President of Cebu Institute of Technology University, Engineer Bernard Villamor.
Thank you. Thank you and good afternoon. Thank you to each one of you in the audience for listening and staying and asking how you can help. As Elvin put it aptly, how can we make the most impact as educators? I know most of you here are already convinced to get the vaccine, but this is part 2 of the webinar, but it was in the part 1 of webinar 1 where I was convinced myself. And remember that movie where the guy says to the girl, "You had me at hello"? Well, I was introducing Father Nick Austriaco then when I introduced him as a summa cum laude of University of Pennsylvania on bioengineering and a PhD in MIT on biology. And that's where he had me. After that, I was convinced that the vaccine. So I hope we can help each other be convinced, because not all of us around us are still convinced. For me, I want to thank the organizers, PACU President Dr. Anthony Tamayo, Loris Suarez, the program chair, and the support of Cocopea, Dr. Lourdes Sese, and PEAC, Doris Ferrer, the cross-post in Cocopea, PEAC, SEAP, Philippine Women's University, President Dr. Marco Benitez, and PEAC and CIT University. I want to thank the speakers for their very valuable inputs. I have been listening intently since the start, and I have made my own reflections. So from Dr. Beverly Hall, it's really came back to why. She said something very profound, that why are we scared of COVID? And I urge you to listen to that sentence, and a very simple sentence, but will convince you why the priority is like that. And Mr. Bill Luz, for helping us, giving us the confidence that there are enough vaccines. And the next problem is really, the next challenge is really execution. And Mr. Manolet Matinola for explaining how we can get Novavax to Dr. Nancy Bermal for the science and efficacy, and to Ms. Rizzi Alejandro. That 5S framework was, I think, is a work of genius, and it's something that we should use. Thank you for sharing that framework. And in the end, we are all part of the solution. And lastly, I just want to say that this webinar too for me, has put in the pieces of the certainty in that puzzle of uncertainty. It's clearer now that where we need to go, how we need to move forward. I'm just very grateful to all of you for your time. And lastly, I want to echo the statement of President Anthony that when you get the chance, get vaccinated. Thank you very much and good day.
Thank you.
Thank you.